It's 9 o'clock. Let's go ahead and let everyone in, and hopefully EJ will be right there.
Okay, we are now live on Facebook, live on YouTube, and Granicus.
And Jake, let me know when the waiting room is empty.
Eddie's on his way in, Mr. Chair.
Nice.
All right, the waiting room is empty.
All right. And everything's good to go on Granicus. I know I heard Facebook, but Granicus is good?
Yes.
Okay. All right. It is 9 a.m. Today is February 2nd, 2021. We'll go ahead and begin our regular meeting for the Board of Supervisors of Lake County. Let's go ahead and have a moment of silence. I'd like to dedicate a moment of silence, and I'll ask if any other board members have one as well before I get started. Okay, Supervisor Crandall, go ahead and get started, Supervisor Crandall.
So I'd like to dedicate a moment of silence to Christine Mora. She was a friend to many, and we ask that you keep her husband, children, and grandchildren in our prayers.
All right, thank you very much. And I would like to dedicate a moment of silence to Marcia Felty Taylor, who worked with the city of Clear Lake, also lived in District 1. Her love and care for animals and trying to find homes was second to none. She worked really hard with animal control in the police department in the city of Clear Lake and just did a fantastic job, and all the way till her last moment was still trying to find a home for her furry babies. And she was loved by many, appreciated by all, and just want to have a moment to remember her. Thank you very much.
I have one as well.
Oh, please, Supervisor.
Gail Barrett, a longtime Cobb resident, very active in the community, just lost her battle with cancer this week. So we're keeping her in our hearts as well.
Thank you for those dedications. I'm trying my best to go from supervisor to supervisor for the Pledge of Allegiance, and I've lost track. So I'm going to start over. Supervisor Scott, if you could please lead us in the Pledge of Allegiance this morning.
Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Supervisor. Okay, let's go ahead and move on to item number 4, consideration of extra items not appearing on the posted agenda. Is there anything from our board or staff that needs to be added?
None that I am aware of, Mr. Chair.
Okay, thank you very much. And I see nothing coming from the supervisors as well. So let's go ahead and move on to item number 5, approval of the consent agenda. Is there any items that wish to be put, that a supervisor wishes to pull for further discussion?
No, I don't have any.
Perfect. Seeing none, let's go ahead and Jake, if we can open it up to the public. This is for pulling an item from our consent agenda, so we can go ahead and have a discussion on it.
All right.
5.1 through 5.10.
I've sent a unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Hearing none, let's go ahead and bring that back for action.
Mr. Chair, I move to approve the consent agenda items 5.1 through 5.10.
Second.
Okay, I have a motion and a second. Johanna, if we can please have a roll call.
Okay, Supervisor Simon,
Yes.
Supervisor Crandall,
Yes.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye. Thank you
you.
very much. So we're going to move on to items number 6, and just wanted to first let everyone know that there will be some changes to the agenda because of the times. The times are a little stacked together, and we want to make sure that every item has the ample time to be discussed. So item 6.2 will be at 9:06 a.m. as it's written. 6.3, we will start at 9:40 a.m. and no earlier. 6.4, 9:45 a.m. and no earlier. 6.5 at 9:50 a.m. and no earlier. And 6.6 has been pulled from the agenda and will return at a future agenda as soon as possible. I believe that that is all the changes that are needed. I'm just going to check real quick with Ms. Hutchinson and make sure I didn't miss anything.
That is all the changes, and I wondered if Jake can post that on his graphic. And Jake, if you didn't catch all those time changes, I'll be happy to send them to you, but it just might be helpful for someone who drops into the meeting to know of those time changes. Is that possible to replace your graphic?
Yeah, I could totally add that. If you would email me those changes, that'd be great.
And I've already sent those over to Jake, so he has them.
He does. Okay, thank you.
All right, so we'll go ahead and move forward with 6.1, our public input. This is for anything the public wishes to make a comment about that is not related to an item on our agenda. Jake, if we can go ahead and open up the Zoom room for any public comment that we have received.
All right, I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Okay, seems to be no public input at this time, so let's go ahead and close public input and open it back up to item 6.2 or 9:06 a.m. Consideration of update on COVID-19, and I see that we have Dr. Pace with us. Dr. Pace, the floor is yours.
Good morning. So Sarah is trying to get in. Let's see. Let me see. We were going to use her today.
I don't see her in the waiting room yet,
Yeah,
Dr.
so she's having trouble getting in. Let's see.
So instead of, let's go ahead and wait, and let's do item 7.3, which is a real simple item, and hopefully that'll give her time to get in. Or do you want to get started, Dr. Pace?
Well, or the other way to do this is, why don't you go ahead and do it, and I'll bring up the slides, and I'll just do them if she can't get in.
Okay, we're going to do 7.3. It'll just be less than 5 minutes, not even.
Okay, great.
Consideration of the following advisory board appointments: Fish and Wildlife Advisory Committee, Animal Control Advisory Board. Any comments or questions from board members on this item? Okay, seeing none. Jake, can we open it up for public input? Any questions or comments on item 7.3 with the appointments to Fish and Wildlife and the Animal Control Advisory Board?
All right, I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Okay, hearing none, let's go ahead and bring it back to the board for action.
Mr. Chair, are you interested in seeing the vacancy list for those two committees before you take action?
Yeah, let's go ahead and take a look at
Show
that,
it to you if you'd like to.
please.
Okay. Okay, so first up, you're looking at the Animal Control Advisory Board. As you can see here, you have 4 vacancies in 4 out of 5 supervisorial districts. I don't have the individual's application open on my desktop because I'm looking at this now.
And that'll be the individual on the list is for District 2.
Okay, so this would be a motivating factor for the supervisors in the other districts to think about who you might want to encourage in your district to be a part of that. And so then moving on to Fish and Wildlife, let's see. Fish and Wildlife is another one with a lot of vacancies. In fact, if memory serves, once some of these appointed here, it could be that staff has not made the updates since last week. And but nonetheless, there are a number of vacancies, and I'll make sure that the updates are made.
If it's possible, since that one has so many vacancies, once the update has been made, would you be able to email that to the supervisors so we know if our district seats have not been filled?
Absolutely.
Appreciate that. Thank you so much.
Thank you.
Any further comments or questions from the board before action?
No.
Then let's go ahead and take action. Sorry, interrupted.
Mr. Chair, I'll go ahead and make a motion to appoint Martin Snyder to the Animal Control Board.
Second?
We have a motion and a second. Johanna, if you could please do a roll call.
Okay, Supervisor Simon,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott, Supervisor Pyska. I didn't hear Supervisor Pyska.
Right, yes.
Okay, and Supervisor Sabatier.
Aye.
Thank you.
Thank you, and thank you for that motion for District 2 Martin Snyder. If we can get a motion for the Fish and Wildlife.
Mr. Chair, I make a motion to appoint Angela De Palma Dow for Fish and Wildlife for District 5.
Second.
We have a motion and a second. If we can get a roll call, please.
Okay, Supervisor Simon,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
And then let's go ahead and finish the last one.
Mr. Chair, I move to approve Terrence Knight, and do you want me to do Chris Decker also?
Yeah.
Chris Decker for the Fish and Wildlife Advisory Committee.
And I'll second that.
Okay, we have a motion from Supervisor Scott and a second from Supervisor Crandall. Johanna, if we can get a roll call, please.
Okay, Supervisor Simon,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Pyska,
Yes.
and Supervisor Sabatier.
Aye.
Thank you.
Thank you very much. And hopefully that gave us time to be ready for item 6.2. So let's go ahead and go back to that. Dr. Pace.
Hi, thank you for postponing a little bit. She's in the room now. So, yeah, good morning, everybody. Good morning, supervisors. Thank you for having us again to update on the COVID situation in the county. So I'll give a quick little overview and then Sarah can do the data. Right now, the cases are falling significantly locally and around the state. The hospital situation is very good at this point. We are concerned about the variants. There's some seems to be spreading. We're not sure exactly what it means yet, but looking at different places around the world, Brazil and London are two places where it's very concerning. It seems to be spreading rapidly, and there are some concerns that we're going to see significant surges in the future from this. We had been feeling pretty good about how things were going to be unfolding in the next couple of months, but that may be changing. We'll have to, we're just waiting to see how that goes. We continue to be in the purple tier, and we can talk a little bit about that later. And but why don't we go into the data with Sarah now?
Good morning, everyone. May I share my screen?
You should be able to do it now. Sorry about that.
Thank you. Like Dr. Pace said, we are seeing a declining case rate, which is really exciting coming off of our peak over the Christmas and New Year holiday. We'll start at the state level though, and the state is seeing similar improvements. So on the left, we see at the state level, the testing remains high, though it has increased in the last couple of weeks here with this dark blue line, which is the 14-day average. This is really promising news that we see on the right. The decline in the testing positivity is down to 7.3%. It was near 15% just a couple of weeks ago. And while testing remains high and we see this dropping, tells us the level of transmission in the community is dropping. And here is our epi curve looking at the number of new cases over time. Here you can see the peak at the statewide level, and just about as rapidly as we saw an increase in cases, we're seeing a very rapid decrease in the number of new cases, down to about 15,000 new cases reported yesterday. And so if you'll recall, we were looking at double that over the month of December. Correspondingly, we've started to turn the corner here, and the number of COVID hospitalized patients down to about 15,000 statewide. Yesterday, again, we were seeing over 20,000 COVID patients. So again, really promising signs. Here in Lake County, we've seen a similar trend to the state. We started to, I'm not going to say bend our curve yet because we just have a couple weeks. We're a little bit behind the state, but we have seen a decrease in the number of new cases identified by week. So as yesterday evening, we've identified 117 new cases. You can see our peak here, these 2 weeks, whereas the week beginning January 17th, we saw 90 cases. And so this week is what makes up our new tier assignment that the state will release today. And then this week of January 24th, the week we just finished, we've identified 89 cases. Now we'll continue to identify new cases throughout this week, so this will increase. So it's really critical, it'll be really critical what we see over the next couple of weeks, but we do seem to see a decline, though I expect we'll see more cases in this week than we saw the previous week. Like Dr. Pace said, we remain in the purple tier. The state will make the official announcement at noon. Our case rate remains in the purple or widespread tier at 21 per 100,000. So while we're still in the purple, the good news is I think last week I reported about 40 per 100,000, and it was close to 60 a couple weeks prior. So it is declining even though transmission remains widespread, and our testing positivity has dropped significantly to about 7%. And this is dropping into what we call the orange tier or substantial transmission. So this is really good news. We'll remain in the purple tier because of our daily case rate, but we're coming back towards what we were in the fall. And most of the state, like Lake County, remains in this purple tier, but most communities seeing a fairly dramatic reduction in transmission. And just a look at ICU capacity. So there has been a decrease, just like we've seen in total hospitalized patients and ICU patients at the state level, down to about 4,000 yesterday. And you can see this line here, we're starting to see an increase in the number of ICU beds available statewide. Just to look more locally, in Lake County, still seeing 6 to 7 of the 8 ICU beds occupied on a daily basis. From 1 to 2 COVID positive patients to 3 or 4 or 5. In Rancho, about 9 to 21% of the ICU patients over the last week have been COVID positive, and about 90 or so occupied ICU beds daily. So looking okay on that front as well. And unfortunately, we've had almost 4,000 new COVID people. We've had almost 4,000 people die of COVID in the last week since I last reported to you, almost to 41,000. As we've seen the number of new infections decline, we'll start to see this dark black line decline, but we have statewide experienced about 4,000 new COVID deaths over the last week. And what is, as everyone knows, so critical in this moment is the number of people, or how rapidly we can get vaccine administered to people who want the vaccine. And I'm showing you here new data looking at people residing in Lake County who have received at least one COVID vaccine dose, and when they got it, what week they got it. So we estimate that about 5,800 people in Lake County have received at least one COVID vaccine dose as of last night, and this is about 9% of the county population. And next week, or whenever we share the data again with you, we'll bring additional information about some of the demographics. So the age of people and where they're living in the county who have received the vaccine. So I'll end there. Dr. Pace, would you like to say anything else on the vaccine slide?
No, that's great. Thank you. Yeah, go ahead and you can unshare. Yeah, thanks. So, I mean, I think a couple of the things that are worth noting there is one, the case rates at about 21 per 100,000. And one of the really important things about that is that the schools can begin to start opening when we're under 25 for 5 days in a row. So we're just starting to approach that point. So the schools that have not been open yet, if they have their safety plans in place, they are allowed to be open there. So I'm sure we'll be in a lot of discussion about that. This came quicker than we expected. It's really dropped dramatically over the last week or so. So we had started talking about that a few weeks ago, that this will be coming in the coming month or so. We weren't sure when, but it looks like it may be right around the corner. The other thing is that we're not at the red zone yet, but it's not completely out of the realm of possibility now that we could be there in the next couple of weeks. And if everybody remembers, that was where we spent a lot of the summer and the fall, and that was when you could have some indoor dining and some other indoor activities. So that may be coming now. So I encourage everybody to keep looking at it. Again, this variant situation is a real curveball. So we're not sure exactly how that's going to impact things, but at least at this point, the trend seems to be very positive and going in the right direction. One of the things I just want to emphasize now is that taking the same precautions is really important. With this variant, it's actually more transmissible. So the things we were doing before, we need to actually be more careful about than we were before. And one of the things people are recommending, that the CDC and other places are recommending, is considering upgrading your mask. So doing a second layer of mask or wearing a surgical mask underneath a cloth mask. So these things are probably will increase protection, and are probably a good idea to do at this point. So the surge was something we were very concerned about for 4 to 6 weeks there after Christmas. And the situation locally is stable over the last week or so. There have not been significant problems with getting people out of the hospitals or getting transport to out of region hospital beds. So this is very good, and hopefully it continues. The vaccine is the thing that we really wanted to talk about today. First off, we'll just talk about the numbers. Like Sarah showed, it looks like somewhere over 5,000 people have gotten their first dose of the vaccine here. Most of that is coming either through the health department, or we've shared some of our vaccine with some of the local clinics, or through Sutter and Adventist. Sutter and Adventist each have their own supply chains coming in, and they each did like 1,000 last week. And the health department did somewhere in that same range. So we are moving forward. All the vaccine we're getting is being used, and we're moving forward as quickly as we can. Second doses have begun, and we're starting to do those as well. People that have gotten the first dose should be getting, through the health department anyhow, should be getting contacted for a second dose appointment if they don't already have one. With the sites, we've been using these 2 stand-up sites, and Southern Adventists have had a variety of different options that they're doing. We're starting to think we probably need to move towards a drive-through site. So we're starting to shift the plans a little bit and starting to look at some of the possibilities of a drive-through. Again, the biggest issue with the vaccine is the amount of vaccine coming into the county. We've got 800 for last week, 800 for this week, and we're waiting to see how much we get in the coming weeks. Still very low amounts, but with the amounts coming in through Southern Adventist, that's really helping, and they have different supply chains. So the state now is starting to hint that they actually are going to have less available in the coming weeks. We're not sure what that means. They had been kind of insinuating that they were going to be getting more in February, but now it's not looking they're not nearly as optimistic. So we're not sure how much it's going to be, and we wait for our allocation, and we're talking with different people all the time about how to get more, but all of the 58 counties in the state are in the same boat. We have continued to focus on the school staff and the senior population. And we're going to talk quite a bit about some of this because I know there's a lot of concern about that. The teachers should be finishing this week in terms of getting offered the vaccine and getting them the ones that wanted them. And the seniors, we continue to work with them. We're calling them through lists off the senior centers or some of the medical providers in the community, trying to target the most vulnerable seniors first. And so we again encourage people not to call the senior centers. They are reaching out off these lists of the Meals on Wheels and other ways that they're identifying who are the most vulnerable people. And currently there are still no appointments available to the general public. There's no number you can call and get an appointment. We are working off these lists so that we try to get the right people to the front of the line. Some providers do have vaccines, so some of the clinical providers in the community and Adventist and Sutter. So those are sometimes you can get appointments through them. As Safeway has also, we've supplied Safeway with some vaccine, and so they've been able to do a certain amount of people as well. So I wanted to talk about the tiers, and this is the way we're prioritizing the people to get vaccinated. So since there's a limited supply, we want to try to work off a timetable to get people vaccinated in some kind of reasonable order. If you look around the country, around the state, there's a lot of these situations where people have been waiting in line for hours and hours, or the websites crash because everybody's trying to get on the website. And the way we've decided to do this, at least at this point, is trying to determine some priorities and then contact people on those lists and get them appointments. Imperfect system for sure and pretty labor intensive, but it's been a way of trying to manage this going forward. Been getting a lot of criticism lately about the way these decisions have been made and lack of transparency and why some people are in the front of the line than others. And so I was going to spend a bit of time today going over that. But one of the solutions, because I've been the one that's basically making the decision, I've been working off of the state guidelines, and the state guidelines are a little bit ambiguous. And so there's always some judgment that's being made on that. But we are talking about creating a group to help kind of advise about this. So Carol might want to talk about that a little bit.
Yes, thank you, Dr. Pace. I'm grateful to be able to work with you to support some of this, and following the model being used presently in some other counties, we're putting together the COVID-19 Ethics Ad Hoc Committee that will focus on helping to prioritize vaccine in Lake County. And so here is an overview of how that committee will function and what its purpose is. It will advise you regarding ethical matters involving the distribution of vaccines in alignment with the state and federal guidelines. The committee will be advisory in nature. And while it is expected that the committee will vote on its recommendations that will be taken under consideration by you, the committee recommendations are not binding, although nonetheless really helpful. The need for this committee is pretty simply put. The local need for vaccine is too great for the number of vaccine doses that are being allocated by the state, and so prioritization is needed. And in addition, from time to time, special circumstances arise, promoting the need to reconsider the prioritization in order to avoid or manage an outbreak in certain priority groups. So we have drafted some ethical principles for this committee. This draft would be pending the convening of the committee and the committee weighing in and adopting these or any reasonable variation of these. But the intent of the committee is to achieve maximum community benefit by optimally protecting the health and well-being of our citizens. And we're referring to both socio and economic well-being. To ensure that each human life is treated with dignity, worth, and value, to mitigate disparities in the disease impact on different populations, to ensure fairness and impartiality, to act transparently, and to make decisions based on the best available evidence. We have invitations pending to a number of local representatives in these groups. The Latino and Native American communities are here because, as it's well documented, there is a considerable amount of disparity with respect to the virus impacting these community members. Also a hospital representative, primary care clinic representative, a representative of the agricultural industry, particularly with ag workers in mind, a business representative, and an at-large member as well. We'll convene this committee on an as-needed basis, and I will support that process along with Lake County Public Health staff. And the initial task for this committee is to establish and confirm its ethical principles, something along the lines of what we've drafted here, and then also to review and make recommendations on the existing plan, which Dr. Pace is about to show you here in just a couple of minutes. And then, of course, on an ongoing basis, to address those situations that come up that prompt a need for change in the prioritization plan. So that's what the committee structure is looking like. And I'll stop sharing this screen. And Dr. Pace, when you're ready, I can share the plan itself as it stands.
Okay, yeah, so thank you for that. So basically what we're trying to do is to make this decision-making process a little more robust, especially since there's been a lot of concern in the community about how things are getting rolled out. What I wanted to do here is talk a little bit about what the state's doing, and then we'll show the plan that we put together a month ago and submitted. And so just to show how we've been working off this, and then updates. So to show what's actually happened. So, you know, these plans get put in place and they don't necessarily get followed through on. So just show you what's happening. Basically, the state now has put out these phases and tiers, which I've talked about some and which are available on the website, and we'll be walking through this. But the idea was to really focus on the healthcare workers and the emergency workers to keep the system going during a surge, because if you saw what happened in New York, it was very concerning, and we wanted to try to keep the hospital people and the ambulance drivers safe. So that was, and the nursing home safe. So that was one of the first parts. And the second part was in phase 1B, tier 1, was essential workers and elders. Initially it started at the 75-year-old, and then they expanded it down to 65-year-old. The problem is we don't have enough vaccine to get all those people. So we're trying to prioritize, and I made the decision to prioritize the teachers and the school staff so that we could get the schools open as soon as possible, because that was, to me, one of the priorities for society, to get the kids back into school before the end of the year. And anything we could do to support that was part of the plan. So the state now, and then there were further tiers with essential workers. The state now is coming out probably today with some new guidelines. So they've kind of changed course again, which is something that's kind of keeps happening, and we're working with it as best we can. I think partly what's happening is it was too complicated, and they feel like it's causing too much confusion. And also, I think they're getting concerned about these variants and the possibility of another surge coming in the near future. So they really want to focus on an age-based approach and remove the work-based categories, the sectors, so that the older people can get, the people that are more likely to die basically are going to be the ones that will be the first to get vaccinated. So since and the timing of such is we're really trying to get vaccine out as quickly as possible now, because these variants are moving around. The more people that are vaccinated, the less it'll move around. So that's part of the backdrop of the strategy. But we're going to keep some of the things in place, and the state's recommending that as well. So if you could go ahead and put that up, Carol, I can kind of walk through it.
So I'm about to put it up, and I want to give a caveat here. It is a table, and it has some page breaks in strange places that I couldn't get out. And so I apologize for that, but I'll just try to move past them when we come to them. So on your screen, you should be able to see phase 1A, tier 1. And Dr. Pace, are you going to review it by phase?
Yeah, I was just going to go down. But so if you look at phase 1A, this is, you can see the different, so basically what this is the plan that we submitted on January 4th to the state. And then the plan for vaccination, some of these I've updated a little bit, and then the project start date and some of the completion dates here. But so basically, phase 1A is essentially complete now. This is basically the hospitals, the clinics, the EMTs, the skilled nursing facilities, all that. These have been pretty much completed now. Everybody's basically been offered vaccine, and many of them have already gotten their second doses. There's probably a few small practices in the community that have fallen through the cracks, and if they're still out there, they should contact us and we'll get them in. So, but you can just kind of go ahead and scroll down a little bit. All the nursing homes have been, the residents have been vaccinated, and the staff that have been interested in it have gotten vaccinated. So then you go into tier 2, the intermediate care facilities. Orchard Park had the pharmacy come out and do that the other day. Home health, we've focused with home health and in-home supportive services on the folks that are moving amongst different houses. So the state's going to come out with some new clarification about this, but there's been some confusion about that. But really what we were trying to do was to, the workers that go from house to house and see different patients, we wanted to try to prevent the spread that way. If somebody's taking care of a family member, they were not considered a huge, as high a priority as the folks that were moving through the other houses. So, so you can keep going then to the next one. So this is one of the page breaks with the tiers. So the community health workers, yeah, keep going. So then we get to the public health field staff, primary care clinics. All those have been completed at this point. And then the other, you can keep going. These other clinics, these are specialty clinics, lab workers, dental clinics, pharmacy staff, other folks like that. They've all been offered it now, or if they haven't been offered it, we've tried to reach out to everybody, but if we haven't gotten to everybody, they can contact us and we'll try to get them in. So again, the idea here was with this first phase was to cover everybody with that's in the kind of the healthcare community so that we could keep the system running as the surge got worse. Now into phase B, this is where it gets, this is where we are right now. We're in 1B, tier 1. And the way this is the state, this was the way the plan was initially written a month ago. So 75 years and older, but then the governor changed it to 65 and older. So we've been focusing on the most vulnerable in the community through the outreach we've been doing. And we're moving along, but there's still a lot to go. There's in the 75 years old and older group, there's 5,700 people, I think, 5,300 people in Lake County. And in the 65 to 74-year-old group, there's 9,000. So, you know, there's almost 14,000 people in this age range, 65 and above, in the county. And so, you know, you can see that it's going to take a little while to get all these folks done. We've done maybe 5,800 in the county, and that's including all the healthcare workers and most of the school staff. So we still have a ways to go, but we're working hard on that. And these are the folks that the 2 hospital chains are particularly good at getting. So we are continuing with that group. And again, focusing on the vulnerable ones. So sorry, slow down a little bit there.
Okay.
Yeah, go ahead and go back a little bit. So this is where the essential worker part comes in, and this is where it's gotten confusing and I think caused people some upset, is that the food and ag community was in this list, and a lot of the idea was these are the essential workers out in the community that are in contact with people at the stores or in the growing capacity, and also these are in the Latino community especially were particularly hard hit by the virus. And there's a real disparity here. And so part of the focus was on this. We have not started vaccinating these folks yet. I hope to do that in the coming weeks and to see what we can do with that. Education and childcare is next. And so this was a priority with the K through 12 teachers and staff. So that's really where the focus was to try to get the kids back into school. Childcare and colleges also were part of this in the state orders, but they've been able to accommodate better than the K through 12. So we really wanted to focus on them and so that we could get the kids back to school. And then emergency services are kind of have a lot of those have already been done through the healthcare and the emergency EMS system, but those will be being done at the same time as this. So then if we go down, so that's the tier we're in now, and we prioritize the some of it by age and by vulnerability and by the schools. So then we'll work with the rest of this tier. Then after this, basically, this was going to be the next phases that were going on, and we had all these plans. But now the state is really looks like they're going to change this around and sort of eliminate a lot of this and just go into an age-based thing. So probably like 60 to 65 years old. Well, sorry, before that, the new thing that they're going to do is the underlying medical conditions, and they've got a specific list of underlying conditions that will qualify that the person's medical provider will have to do. But these are the folks that will be considered high risk if they get sick. So that will come next after the phase 1B tier 1. Then people with chronic medical conditions of 18 to 65 will be next. And then we will move into an age-based range. So all these other plans that we did looks like the state is going to eliminate, and we'll just go to age-based. So I know this is kind of confusing and it's a lot of detail, but I think it's important to see how we're trying to make these decisions and what some of the understanding is behind them. Really, the idea is to try to places where we were having big outbreaks early on, we were trying to vaccinate those people. So some of the congregate living facilities where the elders are together, or people in different kinds of treatment capacities, but they're in a closed place and they can't leave, and the staff can't leave, that we were trying to get those people covered. And also age and the schools have been the priority at this point. So, every day there are decisions that get made. People call me all the time trying to advocate for their staff and things like this. And sometimes there's a vaccine at the end of the day. So sometimes we contact people with that, but generally this is what we're trying to follow. And I've tried to be very meticulous about following this, and the staff has been really good about it. And so that's just to kind of illustrate that. And I'm sure there will be some questions about that. But overall, we are moving along. We're getting the vaccine out as soon as we get it. I'm afraid there may be less vaccine in the coming weeks, but we'll just have to adjust the appointments. We are the vaccine sites working pretty well. And I think we're going to shift to a drive-through for a variety of reasons. And the surge is a lot better right now, but it's really not time for people to let up on their precautions, because this variant potentially could be a real problem. We just don't know yet. But if you look over in London or you look in Brazil, it's very, very concerning. And so I think that's all for me now. And but I'm happy to answer questions.
Thank you very much, Dr. Pace, for your update. Any comments or questions? Supervisor Scott.
I do have a question. Carol, can you bring that back up and go to the top? I'm glad, Dr. Pace, that you talked about those with underlying health conditions. I think right now that's one of my concerns, and constituents also have those concerns. But if you could pull that up.
The very top, Supervisor?
The very top, please.
Okay, let me find my little thingy here.
Because I know we have many in our community with underlying health conditions. If they were to get COVID, they may not survive, just like the ones that are 80 or 75 and older.
Maybe you need a little further down.
No, right there. No, down a little bit, or up, back up.
Okay, thank you.
On the tier 1 with the skilled nursing, you do have or medically vulnerable individuals. What would that include? Because I know we spoke
What
about.
they're saying here is similar settings for older or medically vulnerable. So these are basically congregate living situations for medically vulnerable folks. It's not just medically vulnerable people in their homes. The idea is that certainly you're absolutely right. You know, people with underlying medical conditions are very vulnerable to this. The idea is though is people hopefully can stay home in their place and not get exposed, and the caregivers can get vaccinated, especially if they're moving through different homes. But so it's trying to protect the people that don't have the ability to isolate and to separate from and protect themselves because of a congregate living situation. Those were the highest priority.
You know, Doctor, there are a couple of other places where older adults are referenced in Tier 2, and here's one. And then later in Phase 1C, Tier 1. So, and then there's the younger folks too, as well, that have underlying medical conditions.
Yeah. Well, I really appreciate the committee that you're forming, trying to figure out, you know, how we are going to be getting these vaccines out. And I think that's something that committee needs to look at, is those that do have underlying medical conditions that may be able to isolate, but their caregiver may not be able to, and they have to continue going out into the community to work and then come home and then just have this fear that they're going to be bringing the virus home to their loved one that they're trying to protect. So I just really appreciate all the work that you're doing. And I'm glad that you mentioned that we will be looking at those with underlying health conditions. Thank you.
Thank you, Supervisor. Any other questions or comments? Supervisor Pyska?
I just want to echo my thanks for this committee too. I think it's really wise to have all the different components of our community that are being affected disproportionately. So I appreciate that. I've gotten this question before for people that are 75 or older and they don't have a relationship with a provider or the senior center. So would they call the pharmacy, or what would be the path that they would take?
Well, so these are people that don't have a medical provider?
Believe it or not, it's true.
Well, if you get those people, why don't you get a list and send them to me?
Okay. So if somebody that's 75 or older doesn't have a provider, they should contact their supervisor.
Well, again, what we're trying to do is to particularly focus in the beginning on the ones that are sickest and the most vulnerable. And this is really 65 and above. So those people tend to be plugged into the medical community. I mean, not 100%, but you know, again, what we're trying to do is roll this out as fast as possible and get the most people covered as quickly as possible. So we're really focusing on trying to get large groups of people taken care of quickly. If there's some exceptions of folks that need it and they don't have a medical provider and they don't have any relation with the senior center, yeah, I mean, if those names can get to me, we can try to put together a list and contact those folks.
Okay.
If the best way is through the supervisor, that's fine. Yeah.
Okay. There is a community of people that use holistic providers and, you know, have never reached out to a regular doctor. So I just wanted to make sure that they had a pathway.
Great.
Thank you, Supervisor. Supervisor Simon?
Yeah, thank you for the update, Dr. Pace. And I know, obviously, like I said last week, I think some of your own words, we're being optimistic as we look through the end of this thing. It's a long ways away, but want to, just once again, thank everybody in your department, all EMS, all of the folks with the county that have been working on this diligently, and just really focus on the supply issue. I think that everything that's being done, it's very encouraging to hear. We're using all the doses that we have, but it just continues to be that supply issue. that is the real challenge. And hopefully that'll be figured out in the next 4 to 8 weeks. That's what we're hoping for. Obviously, as supervisors here, it is a priority for us to really do everything we can to contact our federal representatives, because that's really where the supply is coming from, to continue advocate for county, the county constituents and your department, to take the pressure off you guys as the supply increases. So we'll continue to do that. And I just want to let you know that here to support you in any way to help you achieve those goals. The other question I did have here for locally for the senior centers, just a question that came to me as a supervisor was the staff that works at the senior centers. So I know we're working hard with the senior centers. Where would the staff for senior centers fall in that list? Because we do have folks that are coming in, still doing the Meals on Wheels, the drive-through. I know we have staff that works at all of our senior centers here locally. And it was just, I didn't know the answer, so I'm asking you.
Yeah, I think, these are the kind of questions that come up all day long, right?
Yeah. Yeah.
And it's, and for every person that you say, well, okay, let's give them, then somebody else gets squeezed out the backside. So it's, at this point, if they're 65 and above and they're vulnerable in some way, they would be considered able to get vaccinated. If they're younger than that, working at I think some of the drivers, the people that were going to the homes and were going into the homes were able to get vaccinated because they were kind of treated like in-home caregivers. But the folks that are working, preparing the food, that aren't really in contact with the community so much would not be moved to the front of the list.
Okay, I just wanted to, just for clarification, that's what I.
But again, these are the questions that having this committee will help, because literally all day long I'm trying to manage these kinds of questions, and sometimes I do it right, sometimes I miss. So it's
Okay, thank you for that. I did not want to be speaking for your department. Obviously, I think the list that we have there is, like you said, changing daily. I know the state is having calls, and it's completely coming down to you as we move through this process. The next question I had on doses, the doses that we have for Lake County here, are we? We aren't holding any doses back, correct? Are we holding any doses back for the second doses, or are we getting everything out? That's another question that keeps coming up.
Well, so the ones that come into the health department, we are sending them on through because we're supposed to be getting second doses coming in from the state.
Okay.
Some of them we're sharing with some of our partners, like some of the clinics and some of the pharmacies. And, we're saying we think we're going to get a second dose. We're not exactly sure. They seem to be hedging a little bit. And so, if you want to guarantee that, so I'm leaving that up to each entity, how they're messaging it to people, because I have to say the state has been such a moving target with all these things that I'm not sure that they're going to be able to deliver on all the second doses that they say they are. So we're trying to work with it as best we can, and they continue to say that they will be doing that. But there's a lot of discussion now about whether to just get all the doses out right away, and we may not have enough for the second doses, but at least more people are protected. There's a lot of discussion going on at the state and federal level about that right now. But at this point, the general consensus is that the best way to do this is to go ahead and make sure that you get second doses for everybody that got the first dose. But I think if the variant situation worsens, that's probably going to change, where we just put all the doses into first doses. So at this point, we're basically getting everything out. We're not saving, we're not holding back. But it's very much a moving target.
Okay. The other thing, because always looking for one more or two more actually. One on the committee that's being put together, and I know we had the Latino community and we had the Native American community. Was there consideration in talking about our African American community here in Lake County being added to that list? Just a conversation. That was one thing that I looked when we talk about disparities. I think if we could add that just for a conversation piece here today with the board and with your staff. Hopefully we'll have some more conversation before we end this today. And then the other thing is, I know that especially here in South County, I know that some other medical providers, I know that a lot of folks that work over the mountain and other things have Kaiser or other out of area places. Is there anything going on with the public health group in the northern region and the medical groups to kind of share information? Because I imagine we've had folks that haven't gone through a vaccination through Adventist or through Sutter or through the public health department. They may have gotten it in another county they work in or something like that. Is there any sharing of information that's going on around our surrounding communities? Because the reason I bring it up is our vaccination level could be higher than we're reporting, not much, but there could be some folks that we're not catching that may have gotten vaccine in other areas. Just a question. I know we're not adding extra work, not asking for that, but I just trying to pick out positive that could be happening with this vaccination.
Well, a couple things. One is we've got 9% of the population with the first dose so far. That's really good. That's better than a lot of places. And so just to find a positive, that's something that I think with the health department and with Sutter and Adventist working so hard to get these out there, this has been a real push for all three entities to get it out. So, and I think that shows. The second is with your question about the African American folks, we weren't, the numbers are low in Lake County, and we did not notice any kind of unusually high rates of cases, COVID cases in the African American community in Lake County, just from a data point of view. In other parts of the state and the country, that's not true. Those communities are getting hit very, very hard. But in Lake County, that doesn't seem to be the case at this point. So the conversation came up, but we decided to focus on the groups that were actually showing much higher rates of COVID in terms of focusing in this ethics committee. And then your third question, was about Kaiser. It was the data that Sarah showed is actually state data based on county of residence. So that would pick all that up. So the data sharing is very complicated right now, and there's a lot of problems with it like Sutter and Adventist sharing how much vaccine they're getting and all that, because it's part of their corporate structure and they keep information, in a certain way there. But they've been very good about sharing how many people they've gotten vaccinated, and it seems to be correlating with what we're getting from the state. So I think that data is probably pretty good.
All right. Thank you very much.
Thank you, Supervisor. And just to add to that real quick, it's CARE, the California Immunization Registry, that every single person getting the vaccination has to be registered inside that database. And just like Dr. Pace said, it goes back to home residents. Typically, similar to the testing and cases, we know if someone else got tested outside of the area, if that's a case for Lake County, if they reside here. Any further comments? Yeah. Dr. Crandall.
Yes, so Dr. Pace, it's thanks for the report, you and Sarah, of course. It's really relieving to see the numbers somewhat go down. Hopefully we can keep that pace going. I just had a question about in the vaccination portion of this discussion. You mentioned does that encumber health department, Adventist, and Sutter? Is that we, or is we just the health department when you mentioned that?
In terms of the prioritization?
Yeah, because for example, in the report you mentioned that we have vaccinated at least 1,000 this week. Sutter did 1,000, and Adventist did 1,000. And then when you continued on about vaccination, you would say we. So I just making sure that if we is just health or if it encumbers Adventist and Sutter. That makes sense?
Yeah, I'm not sure specifically what I said that would, generally, I probably was saying we kind of as the health department.
Okay. Yeah, so you guys, so the health department is bringing in the 800 a week, and hopefully we can keep that pace.
Right. Right.
And then Adventist, yeah. Oh, go ahead. Sorry.
Yeah, they've got their own supply chain through their corporate structure.
Okay.
And I don't, they have their own ways of determining how much they can get, and I don't really have access to that.
Okay. Well, hopefully we can ensure that this keeps trickling forward the same way, because that's the 3,000 a week after 10 weeks is half our population. I don't know. I just, I'm really concerned because we have I know a lot of questions from different supervisors have mentioned that, that they're getting the questions, and I'm getting a lot as well. 64 and older, they're calling, and I've mentioned with you as well. Called with you and discussed how to get some people to the Mohawk or wherever the case may be. But with the numbers going down, hopefully we can start getting people vaccinated so this can start taking a turn for the better, for the better of everything. And I understand that, the numbers aren't showing highly in the situation for African-American families or Black communities. And I know we don't have a big population, but I still think it's important that we have them represented, if at all possible, like Supervisor Simon said. And I think that's all I have for now.
Thank you, Supervisor. I have a few questions, Dr. Pace. Again, thank you for you and Sarah's report. Glad to see that our numbers are doing well, and I think every single one of us who pays attention to the hub on our website has noticed that those numbers are not climbing like they were a few weeks ago. And a few weeks ago it was in the hundreds. Now it's maybe around the 20s, just as you were saying, it's around 21 per 100,000 or whatever that number was. So that's good news, and hopefully we can see the trend continue to decrease. I want to ask some questions about schools. In the past, there's been the idea that schools was somewhat a split idea, where elementary schools would be treated differently than high schools or middle schools. You mentioned K through 12. Is there still a waiver system to be able to open under purple, even though we have met that threshold of, I think you said it was 28 per 100,000? Is it a waiver system? Is it automatically they can open? And is it all schools, or is it specific grades that can open?
So the waiver system is gone. That got eliminated. The schools need to put together a safety plan. And if we are under the 25 per 100,000 for, I think it's 5 days, and we're approaching that now. It's been for a few days now. So like if we continue like this by next week, that would be possible. They are allowed to open. There's not, they need to submit them to me. I have 5 days to raise questions or concerns. But if I don't do that, if I don't do anything, the school can open, and they need to follow the safety plan.
And again, it's all schools at this moment, not specific grades.
Right.
Okay. Just another question, which I believe I know the answer to. It doesn't matter if 10% of their staff has been vaccinated versus 80% of their staff. Does vaccination have anything to do with school opening, or is it PPE that's more of a direct correlation for safety?
Right. This is independent of vaccination. I mean, the idea was the more we could vaccinate people, the better it would be. The more likely the teachers would be comfortable going back to school, et cetera. But the realization was that in most places, they would not be able to get the teachers vaccinated in time for the schools to get in time that we needed to get the schools open. So the idea was to do it independent of vaccination, but to have vaccination be in a parallel track.
Right, because it's an additional safety measure, obviously. Just for folks to understand some of the comparisons to what's happening in other counties, I know Yolo County, which is a county that also has UC Davis. UC Davis has been absolutely crucial for testing and vaccination. They only, as of I believe this morning, it might have been yesterday, started their 75 and up vaccinations. So we've been doing that already for more than a week. And I think that we can look at different counties, and just like here, there's been decisions to move around in the tiered system based on what the county felt was necessary to do as far as vaccinations. So, you might see one county doing agriculture already, but they may have skipped something else. And so it's not exactly a perfect parallel to compare ourselves to other counties. But I do agree that at 10%, that overall in comparison to other counties, 10% is good. And I hope that we can keep that going. Supervisor Pyska brought up something, and others have chimed in a little bit on it. And right now, the way that we're doing things is by contacting individuals. So if you work at a school, your school has contacted you saying, if you want the vaccine, please go ahead and let us know. We'll get an appointment for you. If you happen to be on a program at the senior center and you fit the age range, please go ahead and make an appointment. Or they'll call you to see if you want to make an appointment. And I think that I want to make sure that this is a conversation as a whole, especially for the ethics committee. Those who are truly vulnerable and disenfranchised are not a part of any program. And that's been slightly mentioned. And I want to make sure that we find a way to be able to access those folks, because right now it's only if you're a part of something, and some people are very much alone and not a part of something, and they're still super vulnerable to what could happen to them, and also very fragile because of their physiological and health state that they have. So just trying to find ways to do that. I really appreciate the vaccine plan that was written out and spelled out step by step. I am in favor of that moving forward. I am curious, as of today, when the state, possibly today, I don't know if it'll be today, you stated today, I know it's coming. When the state comes out with its new vaccine tier plan, will you be readjusting what you just showed us based on what the state is, or what do you anticipate will happen with this new plan? Because their new plan, from what I can tell, they still want to prioritize educators in certain sectors, like emergency health workers and healthcare workers and so on. And then afterwards, once they're done with those top priorities, their idea is to just break it down by age. We'll see what the specifics are when it comes out, but that's been the conversation in our CSAC calls. What is your anticipation in changes to what you just showed us? Will you make the changes to match what the state is offering, or are you looking to the ethics committee to provide those changes?
We are pretty much obligated to align with the state's guidelines, but the one piece you're missing in the way you sketched that out was, yeah, there's going to be the tiers with the older folks and some of the essential workers, and then there's going to be what Supervisor Scott was talking about, the people with chronic medical illnesses that fall into certain categories that are very high risk if they get COVID, and then we'll go into the age-based tiers. So, basically, we will align with the state guidance. We have to. There is some, variability within some of that, and that's what the ethics committee will help with. Some of that is to have these discussions about, should the people that are provide the food at the senior centers, how much of a risk are they at, and how do we weigh all that out and figure out that they should be in front of somebody else? And those are just complicated discussions, and that's where the committee's going to help. But overall, we're going to align with what the state says to do.
Okay. My last thing is about help from the state. I know that you and I had a discussion that the state was sending us folks. Have we received those folks to help with the vaccination process? Because I also know as of yesterday, the National Guard has started to help in certain counties to provide vaccination support. Have we received anything from the state yet, or are they still on their way?
Supposedly they're coming this week.
Okay.
And then they'll need to be trained and kind of onboarded. But, and we're, so the help question is a gigantic one. You can imagine to vaccinate a couple hundred people a day requires a fair amount of staff and support. And, we're getting that from a bunch of different directions and all these appointments require a lot of staff. So, there's been a lot of the county departments have been helping. Other folks in the community have been helping. A lot of the vaccinators are retired docs, retired nurses, and we've been very fortunate. People are showing up. Still, it requires a fair amount of coordination and kind of oversight, and that's what we're just kind of scrambling to keep all that in place.
And then just one last thing, don't mean to harp on the disenfranchised or the truly vulnerable, but let's not also forget that there's a large, I believe in the city of Clear Lake, it's 21% of the population is disabled. Let's make sure that remember also the disabled who may not have the simple access to some of these things as well. Tough conversation, but I appreciate the forward progress in getting that conversation started. And also the transparency level of the plan written out. Will that be posted onto the website?
Mr. Chair, if I may, yes, I was thinking that this committee should have a web page with that information on there. We do need to clean up the document and get some of the page breaks out, and but then we can post updates.
And again, I'm sorry to ask, but the main COVID-19 page under vaccine, all there is a video to talk about the vaccine, which was an interview between Dr. Sharon, I believe it was, and Matthew Rothstein from our administration office. If there was also a link to the actual vaccine page versus having to find it in all the menus at the top, if that can definitely be put on the webpage for simple finding, that would be great because it's got good information in there.
Thank you, Mr. Chair. Matthew Rothstein is here and listening and probably will be on it before we're even done. But if not that soon.
Okay, and that's all the questions I have. Any further questions from Supervisor Pyska? I'll get to you, Chris.
So thanks for that information on the school opening. And I'm on the reopening committee for Middletown Unified. What are you going to be looking for the safety plan? Are you going to be looking for like gradual openings with cohorts, or a hybrid model, or a full opening? What's your expectation for that if we're getting to the point where we can start to look at those things?
This is really not my, the schools, so there's very clear guidelines from the state done with the public health folks and the State Department of Education. And all the superintendents around the county have been very involved in this. And so your superintendent in Middletown's done a great job. He's been very engaged with this. And so, the plans are good. So it's not going to be me saying like what I need for the school to open. It's going to be, are they complying with the safety recommendations from the state level? Do they have the procedures in place? And they all know what those are. And they've been doing good work to get that as reasonably as can be done in the context of their setting. So they just need to submit it to me. And if I have any concerns, I'll get back to them, but otherwise they're good to go.
Thanks for that. Yeah, I know the superintendent understands that, but I just wanted some clarification from you, and I appreciate that just for the general public, because there is an expectation that the schools can just open all the way up. And
the guidelines are, just so if people are interested in reading them, they're long and very, very precise. On the state website, on the California Department of Public Health website, there's a school reopening guide that goes into a lot of detail, and there's checklists and all kinds of stuff. So the superintendents in the schools have been very, very involved in doing the right thing and preparing for this. And so I think everybody should feel very proud of how the school districts have been moving forward with all this and kind of really doing due diligence going forward.
Thank you. Supervisor Crandall?
Yes, I got some feedback with your question. I'm not sure if some of it applies to Supervisor Pyska's. The feedback is all schools have a school site specific protection plan that is attached to their COVID plan. Sutter and Mendo are nearly done vaccinating teachers. Mendocino College started vaccinating teachers earlier than the Office of Ed, and Sutter's nearly done. So that was from Rob Young that works at the Office of Education. He gave me that feedback as he's watching. So I don't know if that answers some of, or I just wanted to give that feedback.
Okay, thank you very much. If there's nothing,
Mr. Chair,
yeah,
I had one more comment. And Dr. Pace, just for, I know we have a large veteran community here in Lake County, obviously, and our veterans are very important to us. Does the VA have a different supply line for our veterans in the county? Where do the veterans fall for Lake County? Is that under private medical or under VA program? Just a question.
I'm not sure. I'm not aware that there's any VA supply coming into the county.
Okay.
So that's a good question. I'll check on that.
Thank you.
thank you for the question, Supervisor. Let's go ahead, Jake, let's go ahead and open up the Zoom room for public comment. If anyone has any questions or comments for this item on the update for COVID-19 and our vaccination process.
All right, I've sent a mute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Melissa Fulton, CEO, pardon me, Lake County Chamber of Commerce. So I have a few points that I wanted to cover. One of them has to do with the volunteers that you need, Dr. Pace, to fully staff these vaccination points. And as would happen, Bernie Butcher from the Blue Wing in Tallman stopped in here just as this meeting was starting. And he said that he received his vaccination because they live part-time in the Bay Area in San Mateo. And they had a system set up where they had a lot of community volunteers, or at least staff, who were directing traffic, who were doing all of the ancillary duties necessary for a very organized procedure. And so I'm just wondering, and forgive me if I've missed this, but I'm wondering if we could have a vaccination volunteer staff menu, very brief, which outlines what you need the volunteers to do. Because I think we have a lot of people in Lake County who would step up if they knew specifically what they were being asked to do. But I think it's a possibly a broad misconception in the community that when you're asking for volunteers for vaccinations, that they think they have to be medically licensed or retired nurses, doctors, so on and so forth, when in fact we know that a lot of the people that you need to coordinate these vaccination clinics, if you will, especially if you go to a drive-through, don't need medical training. So is it possible that the health department could supply the local media, all of our business associations, so we can publicize that, exactly what those needs are for the volunteers, what they're going to be asked to do? I think that could help us get more volunteers. So that's one question. Is there something you can send me?
Well, yeah, that's a great point, Melissa. Thank you for bringing that up, because you're right. Actually, the clinical people is the smallest need. We've got a bunch of folks that are really dedicated and are really helping out right now that are, it's great. They're doing a great job. And but we do need help doing a lot of other things. And as we shift over to the drive-through, we'll probably need even more. And so the way it has to be done, though, is people have to sign up and do some paperwork to be a registered volunteer with the county, so that, you know, insurance is covered and all that kind of stuff. And so if people are interested, they should just send a note into the MOAC, and then we'll refer it to the right person. But it's really, there's a lot with everywhere from disinfecting the chairs where people sit after they're done, to doing data input in the computers. So if you're good with that kind of thing, to traffic control and crowd control and setup and breakdown. So there, you know, there's a lot of stuff, as you can imagine, with hundreds of people coming through a building.
Well, I appreciate that. And I think that the broad community who can communicate with, you know, all of the businesses, a lot of the retirees and whatnot, if we had that menu, rather than send them to you and your staff have to in turn forward that information. And I see Carol raising her hand.
Yeah, I just wanted to add in there that all of this is very actively being worked on. We're at a turning point here with vaccinations where we're likely to change our approach and make it a lot bigger. But we're absolutely working on plans for volunteers and more disaster service workers and support from the cities, et cetera. So many moving parts and all in play, and we won't forget you.
And Ms. Fulton, your 3 minutes are up if you'd like to just wrap it up.
Well, I'm just wondering, are we anticipating this potential rise in cases due to the new strains? Is that something? And I will send Dr. Pace the rest of my questions, because several came up this morning. And I do know that there are a lot of people working on a lot of things, but I think those of us in the public can assist in getting those volunteers for you fairly quickly, as long as they know what they have to do to qualify as a volunteer. So thank you for your time. I appreciate all of this information, and I look forward to hearing from you.
Thank you. And Dr. Pace, I know you had already talked about the new strains, but if you can just repeat again what you know of the possibility, the issues with
Of the variant?
Yeah.
Well, yeah. So can you hear me? It seems like it's breaking
we can hear
up. It's let me call in.
We can
You hear me? Okay. Okay. The concern about the variant is very much unknown. I mean, this is very early, but over the last couple of weeks, I was sort of kind of counseling that we thought this was the worst it was going to be, and things were going to gradually get better now, and we were looking at the kind of the light at the end of the tunnel. Now, because of some of what we're seeing in other places around the world, we're not sure that that's going to be the case. So this is nothing imminent, but it's moving fast in some places, and the potential is this could be a real problem in the coming months. And so I think the bottom line at this point is if you're concerned about this, pay attention to the news, and I'll be reporting on it, but also just be particularly careful with your masks, and probably upgrade your mask at this point, and don't let your guard down in terms of mixing with people from, a lot out in public. So.
Okay, thank you for that. Jake, anyone else in the Zoom room wish to make a public comment?
Kathy Toy.
Yes, Kathy, go.
Yes, thank you to all of you, Dr. Pace and the board. Dr. Pace, you commented earlier that if you had vaccines at the end of the day in some of the sites, that you were giving them out to people that had perhaps contacted you. I suspect probably begging for vaccine. How do you, as the officer, or is there a plan to make that availability more equitable? Like, I've heard this before, that there are leftover vaccines at certain sites. How do we deal with that as a community? how do we get on a list? Is there a list?
Right, I'm sorry, I probably said that in a way that was confusing. We have lists that we're working off of people that qualify under the current tier system. So it's not a free-for-all that like, oh, people just make a line that we'll start vaccinating them, whoever they are. What we're doing is we've got this ongoing list of people that are in the group. So like some of these ones that Supervisor Sabatier was mentioning that are not connected with the senior centers or with medical providers, or Supervisor Pyska was mentioning as well, that, if they send me those lists, then we can have those available at the end of the day. And we reach out to those folks when we're in that part of the town. So the idea is that, we're trying to capture the most people that we can. Some folks are falling through the cracks for various reasons, but that they still qualify and they should be in the front of the line as well. If we have these lists, we can try to either filter them into the appointment system or keep it at the end of the day and contact them to come in. So it's not really the way I probably made it sound, which is like, oh, if you just hang around at the end of the day, you can maybe get one. We're really trying to work within the tier system.
Okay, thank you very much.
Thank you. Any other public comment?
I've sent another unmute request out to the Zoom room floor.
Thank you, Jake. Okay, hearing none, let's go ahead and bring it back to the board. Any further comments or questions?
Dr. Pace? Just a verification question. One of the things I heard we talking about was the different strands of COVID, and of course I've been hearing this in different, articles and in stuff on the news. But I just wanted to know if you knew the vaccination, is that something that will either hinder or stop the new strains from developing? Is that why it's so imperative that we ensure people get vaccinated? Am I on the right track with that?
Right. Yeah, it's a good question. So we're still learning about it, but what happens when there's very high transmission of the virus, the risk of mutation is much greater, and these more contagious strains can spread more quickly. So partly what happens is if you get a lot of the population protected with the vaccination, it slows down the whole transmission, and so it just slows the spread of these things and potentially gives us time to get in front of it. So the strategy right now, they're talking about it, it's like a race against time. So the more people we can get vaccinated quickly, the more likely we are to really slow the spread of these new strains and kind of keep it under control. And the other piece of that is that at this point, we don't know how much these strains are going to be able to escape from the vaccine. So how much the vaccine protects against some of these new strains, probably somewhat less for some of them, whether it doesn't, it probably offers some protection, but maybe less than for the original strain.
Thank you. Thank you very much.
Thank you. And Dr. Pace, I do have a final question for you. I had asked about industry sectors like healthcare last week about what percentage have agreed to get vaccinated. Because we know, like you gave us the total numbers of about 9,000 for 65 to 75, and another 4,000 or 5,000 for 75 plus. So we know approximately what our populations are that we're looking at getting vaccinated. But what percentage of some of those sectors that we've gone ahead and finished up or believe we finished up, there might be some trickling in of others who want to get vaccinated now, who feel more comfortable. Do you know what the percentage is for some of those sectors that we've completed?
Well, I think it's different in different, like in the hospitals, my understanding is it's been somewhere between 60 and 80%. And it tends to be, the doctors tend to be more, maybe the nurses a little less, and, And then folks that are environmental folks and cafeteria folks maybe less, so it's sort of like there's a little bit of a stratification in there. I think in the nursing homes, the staff in the nursing homes is somewhere around 50, 60%, something like that. And all the residents get it. They all get it. And a question came up the other day about if new admissions are getting vaccinated, new admissions to nursing homes. And it sounds like, the nursing homes each have pharmacy partnerships. The pharmacy is going to come out 3 times total to vaccinate. And so they'll pick up these new folks in when they come out the next time. So, I think different settings are different ways. Probably the alternative practitioners will be less interested than the conventional practitioners. And, so it's a very variable thing. But somewhere, I think pretty much what we're seeing is 50+% kind of across the board. And too often what happens is people decline it the first time and then they see their friends getting it a couple weeks later, then they want to get it.
Right. Okay, thank you for that. And I just want to make a statement to the community. And there are, obviously, we've really described the problem that we have here. We just have a limited amount of vaccinations for a much larger population that wants the vaccination. It's not maybe everybody in our community, but it's still a much larger number that wants to be vaccinated versus what we have access to. Countrywide problem, statewide problem, not just a Lake County problem. But I've seen in our community people use their status and their positions and their knowledge of connection or their connections to other community members to get in front of others. And I want to call those people out. That is selfish. We are trying to get things done correctly. We are imperfect too, but we are trying to do better as we move forward and learn from the things that we've done. But to actually try to get in front of the line of someone else who is more frail than you and someone else who might be more likely to be impacted in a negative way by this virus, it is despicable. So please, your turn will come. Everyone who wants to get a vaccination can and will get one. It's a matter of time. Do not throw other people to the side in order for you to get up front. I just learning of some of the things that has happened, it disgusts me. And so please, let's make sure that we treat our neighbors properly and that we look at the fact that we're looking at the big picture. It's not about you, it's not about me, it's about us. And we need to do what we can to make this right. So please be patient, we will get to you. Any final comments from anyone else before we move on? All right, Dr. Pace, thank you very much for today's report. We will see you soon. Thank you so much.
Thank you.
Thank you.
Thank you, Dr. Pace.
Okay, so I know we set new times for all these items, but we're already past those times. Let's go ahead and move forward with item 6.3, or 9:40 a.m., if I'm correct on what it is that I actually said. Presentation of proclamation designated the month of February 2021 Black History Month and celebrating Martin Luther King's birthday. And I believe Supervisor Scott will be reading the proclamation today.
Yes, thank you, Chair. It's my pleasure to read this proclamation today. The Board of Supervisors, County of Lake, State of California proclamation designating the month of February 2021 Black History Month. Whereas the Lake County branch of the National Association for the Advancement of Colored People, NAACP, will celebrate a combination of Black History Month and Martin Luther King's birthday as we reflect on the proud legacy of courage and dedication from visionary leaders like Martin Luther King Jr., Elijah Cummings, John Lewis, Rosa Parks, Cornetta Scott King, Kamala Harris, John Ossoff, Raphael Warnock, Betsy Bell, and remembering Officer Brian D. Sicknick and Officer Howard Lim Bunnygood is appropriate at this time to acknowledge its many achievements and its underscore the positive impacts this organization has made in our local communities. And whereas the NAACP history is one of dedication and struggle to maintain equity and justice for all citizens of the United States. I'm going to read that sentence again. The dedication and struggle to maintain equity and justice for all citizens of the United States. That's something we need to work on. Whereas a local branch, like other NAACP branches throughout the states and country, diligently works on social programs aimed toward the elimination of racial hatred, bigotry, and poverty. Whereas Lake County branch of the NAACP is led by Rick Mayo, president and 1982 founder of the Lake County branch. Now, therefore, it be proclaimed that February 2021 is designated as Black History Month, and the Lake County branch of the National Association for the Advancements of Colored People is committed to the vital role it has played in improving the quality of life of our local community, and the branch to be extended its best wishes and continued success. Passed and adopted the second day of February 2021. And I know Rick was unable to be with us today, but he is in our thoughts. He has done some amazing work, him and his team. We have a lot more work to do. I know this proclamation says maintain equality and justice, but we still have to obtain that for many in our community. So with that, I thank you that we have designated this month, and I was pleased to read the proclamation.
Thank you very much for that. And I just want to add, in my opinion, the way that I wholeheartedly feel Black history is absolutely American history in helping us get to a more perfect union of the ideals that were written in our Declaration of Independence, that all men and women are created equal. And so I appreciate this month for remembering where we've come from and the changes that have been made, because those changes don't just impact the Black community, they impact everyone. And so definitely a month to celebrate. All right. Any other comments from the board on this? And I feel since we made comments, I will open it up to the public. Is there any comments from the public on this proclamation? Jake, if we can open up the Zoom room.
All right, I've sent an unmute request out to the Zoom room floor. If you would like to make a comment, please unmute and state your first and last name.
And thank you, Jake, for posting the proclamation for folks to read along. Okay, seeing no comment, let's go ahead and bring it back. We will move on to our 9:45 a.m. item 6.4, recognition of the Lake County Office of the Auditor Controller, County Clerk for Government Finance Officers Association and State Controller's Office Awards for Excellence in Financial Reporting for the fiscal year ended June 30th, 2019. And I just want to make a quick statement. There is so much that happens in our county that's behind closed doors. We have people working hard every single day, working to serve the people of our community, but also making sure that we are accountable for what we do and that we have everything set straight with the state. The state provides us a lot of dollars. We need to make sure that we account for those dollars, and we also receive a lot of money as well. And we need to make sure that we balance out and that everything is accurately done and maintained. And a lot of that work is being done in our Auditor Controller's office, who oversees all of these functions. And I am going to open up the award. I want to make sure and read this out loud as it slowly opens. So this is from Betty Yee, our California State Controller's Office. Dear Ms. Sederland, I am pleased to congratulate you on the award for county's financial transactions reporting, which Lake County is receiving for preparing a complete financial transactions report for the fiscal year ended June 30th, 2019. In order to qualify for this annual reward, your county has met several key eligibility criteria. Lake County's excellence in reporting helps my team produce accurate and useful local government financial data, which is relied upon by policymakers, researchers, and constituents throughout California. Thank you for your contribution to the quality and transparency of public finances. Please convey my congratulations to all county staff who contributed to your success in receiving this award, signed by Betty T. Yee. And we've also received one from Michelle Mark Levine, who's the Director of Technical Assistance. Dear Ms. Hutchinson, we are pleased to notify you that your comprehensive annual financial report for the fiscal year ended June 30th, 2019 qualifies for GFOA's Certificate of Achievement for Excellence in Financial Reporting. The Certificate of Achievement is the highest form of recognition in governmental accounting and financial reporting, and its attainment represents a significant accomplishment by a government and its management. When a Certificate of Achievement is awarded to a government, an award of financial reporting achievement, AFRA, is also presented to the individuals or department designated by the government as primarily responsible for its having earned the certificate. This award has been sent to the submitter as designated on the application. We hope that you will arrange for a formal presentation of the certificate and award of financial reporting achievement and give appropriate publicity to this notable achievement. A sample news release is included to assist with this effort. We hope that your example will encourage other government officials in their efforts to achieve and maintain an appropriate standard of excellence in financial reporting. Sincerely, Michelle Mark Levine, Director of Technical Services. To our Auditor Controller's Office and all involved in our accounting processes, which also stems outside of our Auditor Controller's Office, I just want to send a huge thank you and absolutely congratulations for being recognized, not by just us, but by the state of California as a whole. So thank you.
Mr. Chair, the Auditor Controller is present. I don't know if she wishes to speak, or she may want to also recognize her staff that are certainly a part of this extraordinary effort.
And I know this is not the first time she's received this award also.
Right.
She is consistently excellent.
Good morning. This is Kathy Saderlin, the Auditor Controller, your Auditor Controller. Hopefully you can all hear me.
We can hear you. We can't see you, but we can hear you.
You can't see me, no. I'm behind my screen right now. So I want to thank your board and the County Administrative Officer, Carol Hutchinson, for this acknowledgement and the opportunity to say a couple words. The two awards presented are the result of the dedication and hard work of the entire Auditor Controller County Clerk's team, and each of them contribute in some way to the data contained within the reports, including collaboration with the County Administrative Office for the Government Finance Officers Award. And to add to what you've already said, the State Controller's Award for Excellence is a determined effort in the compilation of all the county governmental fund financial transaction, and it's in a manner prescribed by the State Controller, and it reflects the financial activities of the County of Lake. We began receiving this award, you kind of mentioned this, in 1999, and we've attained it in the last 18 of 20 years. Lake County's data is combined with all other 58 counties' data on the State Controller's open data website, identified as by the numbers. So we're published out there. Similar yet different, the Government Finance Officers Association Award of Excellence for a CAFR, the county's annual financial report, we refer to it as the CAFR, is an important measure of assurance to your board and to the public that your financial transactions and accounting is performed in accordance with generally accepted accounting principles. It's presented in a manner as prescribed by the Governmental Accounting Standards Board, and it is audited by our independent auditors as a part of our annual countywide independent audit. This report presents the financial position of the county for many purposes, including transparency and accountability, as was mentioned, of your government as a whole, and it's the 16th year we have received this award. This report is available for review on the Auditor Controller webpage on the county website, and you can find it under the financial section reporting. And in summary, I did ask my staff to kind of check in with this meeting in case they wanted to say anything. But I wanted to just close with that. I can't say enough how very proud I am of the Auditor Controller team. They do an enormous amount of work, and they do a notable amount of work to receive these awards. And I do appreciate everything that they do every single day. So if any of them are on the line, I don't see any of them. They're really busy, so it's hard for them to get in here. So, and they all have the capability, they have the technology to do it. So I'm going to be quiet in case any of them are on and they would like to say a few words.
I've sent a unmute request out to the floor to kind of give them the opportunity to unmute and speak.
Clearly, they are very shy or very busy.
We have one coming in.
Awesome.
So we are looking for auditor controller staff in case they wanted to say anything based on receiving this achievement award. I'm going to just put one on the spot. Yep, I see that Ms. Harrison unmuted. Would you like to say something, Ms. Harrison?
I just want to thank our staff as a whole. Like Kathy said, it's a collaborative effort, and we all definitely do our part to make sure everything gets done on a daily, weekly, monthly, quarterly basis.
Okay, thank you. There you are. Is that it, Ms. Harrison?
Can you guys hear me?
We can hear you and we can see you. And if you can turn your volume off, I don't know if that's you or if it's a neighboring cubicle, we can hear us repeated in the background. Okay. Anyone else from the Auditor Controller's Office wish to say something?
I'm here. Something weird was happening with my.
If you can turn your volume off, I don't know if that's you.
So, Marcy, it sounds like you have Granicus playing there.
Yeah, I think she turned it off just now. I do want to just add again that oftentimes I've dealt with the Auditor Controller's Office. That is my go-to for any time I need some financial information or some financial understanding of what's going on and how things will be impacted based on our decisions here as a board. But I also want to say that the customer service, the level, the standard is definitely one of the highest that I've seen in our county as far as the department goes. Always kind, always patient, always informative. Really appreciate all of your staff that you have there. Always getting the answers that I need, and that includes helping other constituents as well. So just wanted to make sure and share the appreciation further than just the supervisors or managers of the department.
Thank you very much.
Any other comments from board members?
Yes.
Supervisor Crandall, go for it.
Sorry, Moke. You go ahead and go first, Moke.
No, go ahead, Supervisor Crandall.
I was just going to repeat the same thing, Bruno. I take a lot of consideration when Ms. Saderlin is in the meetings with us, and I know her department works very hard for her and for the county in general. And so this is I'm glad to see them receive this. It's very well deserved.
Yeah, I just want to thank Kathy and all of the staff. As Tina noted, this is something that, has happened for many years. I think, Kathy, you said 16 years, and it just goes to the hard work and dedication we have here, in this department and through all of our departments. But Kathy, thank you for your leadership, and thank everyone for this department. It is always something. The Auditor Controller always keeps us grounded and informed as we try and make decisions for our constituents. in this county. I just want to thank you for your long-term service and all of your department's hard work on our reporting on a yearly basis. It's so important to help us continue to make the lives better here in Lake County. And this is just another shining example of our Lake County staff that we have here. And your department is constantly, like we said, yearly getting these awards. So thank you very much.
Thank you.
Okay, Jake, let's go ahead and open up the Zoom room for public comment. See if anyone has a comment they would like to make.
All right, I've sent an unmute request out to the Zoom room floor. If you would like to make a comment, please unmute and state your first and last name.
Okay, hearing none, bring it back to the board. Any final comments before we move on to the next item?
Just a comment from me, Kathy, I haven't had my orientation with you yet, but I have sat in the boardroom for a long time, and I've always enjoyed your presentations, and I've learned a lot over the years now, and I'm really looking forward to partnering with you, and congratulations on this. Excellent work.
Thank you. I'm looking forward to our meeting on Thursday.
Lots of notes. All right, thank you so much to all of your department. Thank you, Ms. Saderlin, for all your hard work, and we will talk to you soon. Thank you. So a quick question. It is 10:51 a.m. We have a presentation from the Blue Ribbon Committee. Do you have an idea of the length of that? Should we take a break now or should we take a break later?
I think we should take a break now, Supervisor.
Okay, I'm getting a couple of nods, so let's go ahead and take a 9-minute break and come back at 11 a.m.
Thank you, Mr. Chair.
Okay, I have 11 a.m. Looks like we have at least 3 of us to be able to reconvene. And I'm sure the other 2 are just either behind their screen and not turn on their cameras or right around the corner. Who do we have here? I don't know if I saw. Who do we have here to do our Blue Ribbon Committee presentation?
Good afternoon, Supervisor Sabatier. My name is Sam McGill. I'm the Senior Facilitator and Project Manager for the Blue Ribbon Committee.
All right, thank you for being here, Mr. McGill. Do you need your screen to be shared or do we have your presentation here?
Yeah, if I could share my screen, that would be wonderful.
Okay, let me go ahead and open up the topic. It looks like everybody's back on. We are going to start our 6.5 item, consideration of annual report by the Blue Ribbon Committee. And Jake, if we can let him have that share screen, there we go. And Mr. McGill, unless our board representatives want to start this off with a quick introduction.
I'll go ahead and just kind of explain. I'm not sure if we talked about what the Blue Ribbon Committee is. Have we talked about that yet, or?
Let's go for it.
Okay, and so it's a 15-member Blue Ribbon Committee for the rehabilitation of Clear Lake, created by Assembly Bill 707. Cecilia Aguilar Curry proposed it. CH 842 Statutes of 2017. It includes representatives from tribes, County of Lake, UC Davis, and the Central Valley Regional Water Quality Control Board. It also includes 4 members appointed by the County of Lake with expertise in agriculture, economics, environment, and public water supplies. And so the committee has been given the important charge of making recommendations for rehabilitating the lake, which is critical to Lake County's economy, ecosystem, and heritage. And so with that, I don't know if Supervisor Simon, if you have anything, but if not, we'll move forward from there.
I just appreciate the report today. I know it's a yearly thing, so I know the hard work that's been done. We're always getting the communications on what's happening on the meeting, so just appreciate the report coming through today.
Okay, Mr. McGill, the floor is yours. Thank you.
All right. Thank you, Mr. Chairman and members of the board. As I mentioned at the outset, my name is Sam McGill. I am a senior facilitator with the Sacramento State University Consensus and Collaboration Program. We were brought on by the California Natural Resources Agency to provide logistical support and facilitation for the committee process. The slides that I have today are quite brief. It should only take me about 5 minutes, and I really wanted to set most of the time aside to answer any of your questions as needed. I'd also personally just like to thank Supervisor Crandall for his continued support and participation in the committee process. We're finally to a place where we're making some pretty serious progress on the committee's recommendations, and it's exciting to see that continued commitment and moving towards implementation of some of these measures. So just real quickly, Supervisor Crandall covered some of this already, but I wanted to provide a quick introduction to our team, just so that you have some contacts if you do have any questions after this presentation. Supervisor Crandall talked briefly about the committee's background and purpose, as well as the membership, so I can move through those quickly. We have done a number of these presentations to various community organizations and cities around Clear Lake, but what we've found is that there's still some confusion about the organizational structure of the committee itself and our coordination with some of the ancillary research activities that are happening in parallel. So I'll talk about that just a little bit. But then really the majority of the time that I wanted to spend is on the committee's annual activities and the actual recommendations that have been submitted this year. So just real quickly, we have a great team of folks that are sort of championing this effort at the state level. Our chairman, Eric Sklar, serves as the chairman of the Blue Ribbon Committee. He's also the president of the California Fish and Game Commission. So it's great having somebody who's plugged into all of the, with all of the different leaders at the Resources Agency on this effort. My colleague and our managing senior mediator, Dave Sepos, serves as the overall project manager, but I'm really the day-to-day contact on the project itself. As I said, if you have any questions about this moving forward, you can certainly reach out to me. I know Supervisor Crandall has my contact information, as does Supervisor Simon. And we have a slide at the end that provides that information as well. Then I'm supported by my two great colleagues, Sophie Carrillo-Mandel and Danica DeBow. So it's wonderful to have them on board as well. Just very quickly, as Supervisor Crandall mentioned, the committee was established by AB 707 in 2017. The legislation specifically forms the committee and specifies the membership. That's kind of an important point, just so you know, that membership is specified in the legislation itself and not at the local level. And at the end of the day, you know, the whole purpose of the committee is to develop really detailed recommendations to clean up the lake for environmental gains, that will also increase its regional prominence for recreation and economic development. You know, it's often said that as Clear Lake goes, so goes Lake County. It's a wonderful, wonderful resource. And I know that all of the people involved in the committee are really dedicated to making some of those improvements over the long run. Just one note. Every year, and it's specified again in the legislation, the committee's primary work product is an annual report to the legislature and governor that's required before January 1st of each year. The effort was launched in 2018. We delivered the first annual report to the governor and legislature on January 1st of last year. And then most recently, the most recent report was delivered to the Resources Agency for distribution to those same parties on December 29th of, and I do apologize, that should be December 29th, 2020. The committee is made up of 7 federally recognized tribes in the area immediately impacted by Clear Lake conditions. We have 1 member of the Board of Supervisors. Thank you very much, Supervisor Crandall, for serving as the primary representative, and Supervisor Simon as the alternate. Likewise, the county itself also appointed experts in the following areas. So we have local economic development, agriculture, the environment, and public water supplier. Then there's sort of these 2 at-large seats as well, one by UC Davis and one seat occupied by the Central Valley Regional Water Quality Control Board. The committee itself is, because it's a formal body established by legislation, it is subject to all of the requirements of the Bagley-Keene Open Meetings Act. So we do make sure that we follow many of the same rules that you do at the local level. We must have a quorum present to make any decisions, and all meetings are open to the public and publicly noticed. I do apologize for how kind of busy this slide looks, but I just wanted to give you all kind of a quick overview of how the committee itself functions. So the Resources Agency serves as kind of the parent organization. The legislation establishes the Blue Ribbon Committee as a specific program under the Resources Agency, but ultimately, between that relationship, the Resources Agency is required to kind of approve and shepherd all of the recommendations the committee comes up with through the legislature and governor's office, whether that's a budget change proposal in the future, advocating for specific recommendations. That's really kind of the Resources Agency's bailiwick. The Blue Ribbon Committee itself, though, at the local level is the decision-making body and approves all of those recommendations. And then it also has several subcommittees. The one that's been operating the longest is our technical subcommittee. That group is really involved with developing specific recommendations to address some of the water quality challenges that Clear Lake has, and is focused very much on kind of the hard lake science. But as Assemblymember Aguilar-Curry's office has impressed on us a number of times, the socioeconomics are critical as well. The legislation finds that Clear Lake is one of the primary economic drivers of Lake County, which you're all very, very well aware of. So we have this other group to come up with socioeconomic recommendations to improve the social and economic well-being of communities directly impacted by the health of the lake as well. There's also a third group that we haven't convened yet, but given the really critical importance of the lake for many of the cultures around the lake itself, we've set up or will set up a cultural and traditional ecological knowledge subcommittee. So that's in the works, but it hasn't been launched yet. And then the final thing that I'll mention on this slide, in addition to sort of the formal structure of the committee, UC Davis also has contracts through the California Department of Fish and Wildlife to conduct research both in the lake and in the communities around the lake. So on one side, you have a number of experts from the Tahoe Environmental Research Center who are really, they're one of the premier bodies in the entire world for developing a good understanding of lake science. And they've been hard at work developing a monitoring network within the lake to understand what drives some of the environmental challenges. And that work is funded through, I believe, June of this year. Then on the other side, UC Davis also has a contract. Their Center for Regional Change is developing an economic development strategy, and they've reached out to a number of folks throughout the county, including many of the tribes, the Economic Development Commission, and others to help formulate an economic development strategy. Both of those groups are separate from the committee process, but we've really strived and will continue to work to make sure that there's sort of a free exchange of information between what the committee's doing and what those research groups are doing, so that we can inform their work products and vice versa. But I do want to make sure that everyone understands those are separate efforts. Want to give you just a real quick rundown of what our yearly process typically looks like. The legislation specifies that the committee has to meet at least quarterly, but we can and certainly have scheduled additional meetings as needed. So around the spring of each year, the committee meets to discuss the status of funding its previous year's recommendations and sets priorities for the current year. In the summer, the committee reconvenes to review progress from those subcommittees that I just mentioned and provide guidance for their recommendations for the current calendar year. And then the fall and winter meetings are used to review those recommendations, refine them, and finalize the report by the end of each year. So in this case, the last committee meeting was on December 9th, and they formally approved the recommendations at that time. I already mentioned the technical and socioeconomic subcommittees. One thing, so I won't go over that. One thing I do want to point out, though, is that as other key topics that any members of the public or the committee are interested in hearing about, we can convene additional ad hoc subcommittees to continue to inform the larger committee's work. All right, so what does this all mean? To date, the recommendations have focused very much on information gathering to determine where and why some of the water quality issues occur around the lake. I think many of you are very familiar with, in particular, the cyanobacteria blooms that occur at times throughout the lake. Those have a variety of impacts to lake health, to recreation around the lake, and to water supply treatment costs. So the committee has focused very much on that cyanobacteria issue and the harmful algal blooms that occasionally occur. But there's also legacy mercury issues that I'm sure many of you are very familiar with as well. So we've been working off and on with EPA since they manage much of the remediation for the Sulphur Bank mercury mine site. We want to make sure that the committee is really kind of a clearinghouse and a spot where a lot of that information can be digested and turned into actionable recommendations. For 2020, the committee has requested $6.5 million from the 2020 state budget for 5 primary recommendations. That includes a distributed hydrologic model of the upper watershed, comprehensive monitoring plan for the same area. So those are all of the tributaries feeding into the lake itself. The committee has also requested a bathymetric survey, and that will really be used to inform UC Davis's research that's currently ongoing. Then the last 2 items were to conduct a review on the implementation and efficacy of existing programs, regulations and best practices that are already required. Some of you may be familiar with the Central Valley Regional Water Quality Control Boards, TMDL, Total Maximum Daily Load, that's a regulatory process. And the committee realized, they kind of wanted to find out, are those regulations really achieving what they were meant to? Are the different best management practices that, for example, the agricultural community, marina owners, whoever it may be, were those actually installed, and are they achieving what they were designed to do? And then the final thing that the committee has recommended is an assessment of public attitudes and behaviors impacting water quality. These recommendations were unanimously approved by the committee at that December 9th meeting. And as I already mentioned, the report and all of the recommendations were sent off to Resources for Distribution on December 29th. Just a couple of other slides. I wanted to quickly run through the status of the recommendations. Governor Newsom's most recent January draft of the 2021 budget does not include funding for committee activities. It shouldn't come as a surprise, and you all discussed it at length, that obviously the priority at the state level right now is managing and dealing with the pandemic. That said, the state does have a significant budget surplus going into 2021, and I know, and we continue to meet with Assemblymember Aguilar-Curry's staff on the additional money that the committee is requesting. I would really say that you have no bigger advocate for her than her at the state level. So it's been encouraging to see that she and her staff are both really dedicated to this process and securing the additional money that the committee has requested. That said, despite not getting the full amount funded through at least the January budget, that may of course change by the time the May revise is released, but the committee did approve funding of the modeling piece that I mentioned and the monitoring piece, utilizing $5 million of Proposition 68 funding that was allocated to the committee at its formation. So that's exciting. We do expect both of those things to actually move forward this year and begin implementation. But as with everything, we want to make sure that we're not putting all of our eggs in one basket. We continue to explore additional options for funding all of the recommendations, including grants and potential federal sources as well. In the meantime, we don't want to lose what progress we've already made. So the committee continues to meet to develop implementation plans for all of the recommendations as soon as that funding becomes available. And just one thing that I wanted to mention before I wrap up here, hopefully it's clear the recommendations that have been designed to date are really seeking to understand why issues are occurring before any large scale kind of on the ground water quality improvement projects can take place. That said, I know, and Supervisor Crandall has specifically advocated for one project, but 2 smaller scale on the ground improvement projects have been identified by the committee to improve to improve specific tributaries on Clover Creek in Upper Lake and Kelsey Creek, the replacement of the existing Kelsey Creek fish ladder. Those projects are both still in draft form, and we hope to discuss them and get approval to move forward with funding those at the committee's March meeting, if indeed the committee wants to head in that direction. So I guess, you know, one of the big takeaways that I wanted to leave with all of you is that we know in the outreach we've done to various community groups and through the committee itself, we know that people want to see tangible on the ground projects developed as soon as possible. But you have to understand, at least the direction we've received is that, you know, you have to understand the science of the lake and why the problems are occurring before some of the specific projects can be developed. And that will, in the long run, just help kind of maximize efficiencies as water quality improvement projects are developed and make sure that any investment is really backed up by sound science. This is expected to be a multi-year process. As I mentioned, I know Assemblymember Aguilar-Curry's staff is a very strong advocate for it and wants to see it continue. And we're getting to a place where, you know, over the next couple of years, the lake science will be understood to a much greater degree than it ever has been in the past. And some of those projects can start being developed. So with that, I really wanted to stop and again, thank you all for the opportunity to present here today. We do have that final report for 2021. I'd be happy to share it. I know Supervisor Crandall has a copy of it, and we can share it with the full board as well. Our contact information is up here on the page that you see in front of you. If you have any questions at all about the process in the future, feel free to reach out to me at any time. You have my email address there. And with that, I just wanted to give you all the opportunity to ask any questions you might have.
Thank you very much, Mr. McGill, for your presentation. Any questions or comments from board members? Supervisor Scott.
I don't have any questions, just thankful that we're moving forward with this committee. I know when I was first seated on the board, I had a conversation with our Assemblywoman, and we were very fortunate to have her fighting for Lake County to put this committee together, and it came with funding, which doesn't always happen when you form things. So I'm just really appreciative that we're moving forward, and I think we have a pretty good idea of what our problems are, and then the phosphorus overload and such. So I'm really excited to see what projects we come up with to start resolving some of these issues that we have in our lake.
All right, thank you very much. Any other comments? Yeah, Supervisor Pyska.
I just want to echo what Supervisor Scott said. I'm really grateful for this committee and the work they've been doing. I was lucky enough to sit in on several sessions over the past couple of years. Just can't do it now because of Brown Act, but that's okay. I also was part of the socioeconomic subcommittee. So a lot is being discussed. There's a lot on the table, and I'm really hopeful for the work that's happening with this group. And I appreciate that there are some alternate funding sources possibly for this year.
Okay, thank you. Any other comments or questions? I know that I spoke with our Assemblywoman Aguilar-Curry not too long ago, where because of the amount that the state is putting into the whole pandemic and trying to help businesses, help people, get the testing out, get the vaccine out, there's been some setbacks in the budgets. And I know she was fighting hard to try and maintain that budget to be able to continue the work that the Blue Ribbon Committee is doing. We're going to see how everything ends up once the numbers are finalized. I want to ask the studies that are happening. I know that there was a major study done from UC Davis back in 1994. Will there be comparisons to what we see today versus what we see then, just to see maybe what's happened physically and environmentally between 1994 and now, to see what the differences are, to see maybe what changes we can apply here locally? What's the end game thinking with once those surveys and studies are completed?
Yeah, that's a great question. I don't want to speak for them too much, and I'm certainly not an expert in the types of modeling and studies that they're doing. But the current UC Davis team through the Tahoe Environmental Research Center has been looking at historical data, and I believe will be doing that type of comparison. The important thing that I would just leave, I talked a little bit about a hydrologic model for the upper watershed, so that'll kind of talk about what's happening in the tributaries. The idea is that that integrates with the work that Davis is doing in the lake itself to tell the whole story of why, as the supervisor just mentioned, the phosphorus, why it's occurring in certain places more than others, and hopefully develop those targeted actions. So yes, I'm fairly certain that comparison will happen, and I'd be happy to follow up with them to get confirmation of that.
Awesome. And I also know from Supervisor Crandall being on the Middle Creek Restoration Project Committee that he's also brought that project to the Blue Ribbon Committee, and we've gotten support from that committee as well, since it's a symbiotic project. In my opinion, what happens at the Middle Creek area is going to absolutely impact the lake and vice versa.
Absolutely, yeah.
And so I appreciate the fact that the Blue Ribbon has taken on that stand to support that project, as I think it's one of the most pivotal projects that we can continue to work on if we want to see change in the quality of our water in Clear Lake. So I appreciate that. Supervisor Crandall?
Yes, no, I just wanted to add to that. The Blue Ribbon Committee and the Middle Creek Restoration Committee, I know there's been multiple occasions where we've brought either letters of support or vice versa back and forth. I did present the Clover Creek Chai Restoration Project to Middle Creek Restoration, and then also brought it forward there. I'm on delay right now working on getting numbers, and also found out that there's some movement in Clover Creek in regards to the Water Resources Department. So I'm working with that department to kind of get things lined up for a better presentation in March. But it's a supported project, but I need to have more numbers tied in. But it's still a good project, and I know it'll help the situation. I know that the other project that was brought forward, the Kelsey, I think it is, the Adobe Creek, very good project as well. What's that, Sam?
Oh, sorry. Yes, Kelsey Creek fish ladder improvement that's also targeting chai or hitch.
Right, and very, very well represented. I need to have more numbers like that project, which will accentuate the need, and when it comes to the getting funding and getting projects move forward. And then also, there's been a lot of discussion as a result of these Blue Ribbon Committees of folks that are on the other side of the lake, especially Clear Lake Oaks. Because of that area, I know people want to talk about doing things like that, of course. So there's a lot of discussion going on because of the shape of our lake, and so I appreciate being on this committee and trying to get what we can done. So that's all I have.
Thank you very much. I do have one final question, and it's kind of a very specific question, and I'm sorry if it's not appropriate for the greater conversation we're having, but we've talked about dredging in the past year or so, and I know that's still coming up, at least for the Lucerne Harbor. But I also know, I believe, I could be wrong, that the hitch, their spawning grounds are closer to the shore than in the middle of the lake. Is dredging a tool that can be used to help save some of those situations that we're seeing with our fish? Is that something that's being discussed in the Blue Ribbon Committee, or is that not being discussed, or is that maybe a discussion that will occur after the study is done?
Like I said, I'm not a lake science expert by any means, but dredging has come up in some of our conversations, especially in the technical subcommittee. And the answer that we've received from USGS and UCD and the folks that really know this stuff backwards and forwards, as well as your own wonderful Water Resources Department, is kind of get the studies completed first, understand the problem, and then move on to those specific items. But I know, as you mentioned, the Middle Creek Restoration Project, that's done in partnership with the U.S. Army Corps of Engineers. As you all know, working with your federal partners, it takes quite some time to get those moving forward. We're hoping once these studies are completed that some of the smaller, more localized projects can happen on a faster timeline than that potentially, decadal Middle Creek project.
I wish it was a decade old. Okay, I appreciate the answer. I'm glad that it's being at least discussed, and we'll see where it goes once the studies are over. Any further comments or questions from the board before I open it up for the public?
Just real quick, Bruno, another thing, especially when it comes to Clover Creek, a lot of growth in the actual Clover Creek is hindering sediment, and the growth is hindering, and that's why you're hearing about fish ladders and whatnot for them to spawn. And so I don't know if it's dredging or if they're just removing, and that's one of the biggest things, is finding out what's in the soil, studies in that type of capacities to ensure that we're not removing and taking something somewhere else. And so so yeah, what your question is in the ballpark, and it's been discussed.
I appreciate that. Thank you for all the work from that committee. Let's go ahead and Jake, let's open it up in the Zoom room if there's any public comment about the Blue Ribbon Committee report that we just received.
All right, I've sent an unmute request out to the Zoom room floor. If you would like to make a comment, please unmute and state your first and last name.
Okay, hearing none, let's go ahead and close public comment and bring it back to the board. Any final comments before we move on? Mr. McGill, thank you so much for your presentation and your team's hard work. I'm looking forward to some of those goals being completed and some of those studies being completed so that we can hear more of what kind of action plan we might be looking at in the near future.
Great. Thank you all very much, and we're happy to come back and provide updates anytime. Thank you.
And I will say this, and I can't say it as the board, but myself, if there's need for the board to look at taking action to try and get you the funding needed for these things, I would say please come back for a discussion at the board, because I want to see the funding coming through.
Absolutely. Thank you very much.
Okay, thank you so much. I didn't hear from Ms. Grant, so I think my comment was okay. So let's go ahead and move on to our non-timed items. Let's look at 7.2, consideration and approval of classification, compensation, recruitment, and retention committee, findings and recommendations arising from departmental 2019 CPS HR classification and total compensation study review requests. Ms. Hutchinson.
Thank you, Mr. Chair. So we have a lot of people on hand for this item. From our class and comp study implementation team, Matthew Rothstein will introduce the item. Pam Samick is here to answer any classification issues. If you have questions, Stephen Carter is on hand if there are questions about salary grades. And then we also have members of our department heads who serve on the class and comp committee and department heads whose requests are in those before you today. And then of course, our two board members, Supervisor Scott and Supervisor Simon, who serve on this committee. So with that said, I'll turn it over to Matthew.
Thank you very much. I'm Matthew Rothstein, Deputy County Administrative Officer. As always, it's a great privilege to address your board today. Late last year, your board acted to enable phase 1 of the implementation of Lake County's classification and total compensation study conducted by CPS HR. And in the time since, the study project management team, comprised of staff members from the County Administrative Office and Human Resources, issued a call for study review requests by department heads. That is, review of the salary grades assigned to classifications within departments and other actions that were taken over the course of the study. Now, when we issued the call for review requests, we tried to make it really clear that this was not to be a redo of the study in total, and that requests would be eligible only on the basis of data gathered over the course of the study and principles that were inherent within the study's methodology. In total, 7 department heads submitted requests for review, and in January, the Classification, Compensation, Recruitment, and Retention Committee determined that 4 classifications warranted adjustments on the basis of the feedback that we received from department heads. The committee's recommendations are described in the memo that was presented to you by County Administrative Officer Hutchinson, and as Carol mentioned, Pam Samick and Stephen Carter of the project management team are also here to answer any questions your board may have. Thank you very much.
Okay, thank you. Any comments or questions from the board?
I would just speak from the past, being the appointee with Supervisor Scott of, obviously working through this process. When we go through things like this, obviously this is a big step forward for Lake County. I know that there are some things we committed to as a board to go back and look and see if there were any things that we needed to consider. And I know that what we brought through today are some considerations we thought that we needed to be adjusted, and we'll continue working through this process. Ultimately, in the long run, I know we have more work to do as a board to really help support all of our departments, our employees here in Lake County. And I just want to thank everybody for being committed to this and helping really establish the class and comp study, at its baseline to begin moving forward here in Lake County. So that's really what I have to say today. And thank you very much.
And for myself, I was new to this committee, so this was my first meeting. We really have come a long way with now implementing our class and comp study. And I know we were just trying to look back and make sure that we didn't have any misclassifications of our employees. And it was a privilege to sit on this committee, and I'm excited for the future and see what we can do to better the lives of our employees here working for the County of Lake.
Okay. Any other comments from supervisors? And then I know that Ms. Samick is unmuted. Wanted to check in with her to see if she had any further presentation to offer.
No, I just unmuted just in case you had questions.
All right. Appreciate you being here, and thank you for your work and your part in this. Since there's no further comments or questions, let's go ahead and open up to the public Zoom room. Jake, please.
All right. I have sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Okay, hearing none, let's go ahead and bring it back to the board. I just wanted to at least make one statement. It's a small fragment of a statement, but I was interested in the cost that this would have on the county based on the fact that we are updating some. The update is minimal in comparison to what we saw back in December. December, it was almost across the board. Here, it's just some subtle changes and some reclassifying here and there, or reopening of classifications that may have been dropped before. And I don't have the email in front of me, but I know it was a maximum of $400 to the general fund per year that we would see an impact. I do not have the specific numbers for the impact to the self-funded agencies, but that will also be handled within those agencies and is afforded by those agencies. I will work on getting that number because I think it's important to at least be transparent in what this does. But I do know that it is something that was requested by the department heads, is going to help them with their ability for people to move through from one position to another rather than being restricted in upward mobility. And it is also afforded by those agencies or those departments with the self-funding that they receive through the state. So I wanted to make sure that that was out there because I think it's always important to understand the financial impact when we make decisions like this. And I'm sorry that I only have partial, but I will come back to the rest. And again, the impact is minimal in comparison to what we did in the past. Any further comments? And I am looking at my agenda. I believe all we're doing is providing direction to staff, and then eventually staff will come back to us with the resolution. Is that correct, Ms. Hutchinson?
Yes, for the employment and training worker class, they are a represented group, and we do need to complete the meet and confer process with them. And so once we do that, then we'll come back with a resolution for all of these changes. That may be as soon as next week. It's possible, although that might be pushing it a little, probably more likely the 23rd.
Okay, and at that point in time is when I plan on making sure I have all the rest of the financial information of what that impact looks like for the other departments, just for full transparency purposes. And it looks to me, if we can get a yes or a nod from our
Yes.
supervisors that we are go ahead and providing that consensus. Looks like it's unanimous. So let's go ahead and move on that and bring it back when you're ready.
Thank you, board.
All right. Thank you to the committee. And we went into this knowing that there might be some lingering issues that we need to deal with. And so this was a part of that process. And conversations will continue to see what possibly might be next. Okay, let's go ahead and move on to item 7.4. Oh, no, we are going to, if I'm correct, Ms. Hutchinson, I believe that we are going to postpone 7.4 and bring that back when it is ready to be on the agenda again. Is that correct?
That is correct. At the request of Public Works Director Scott DeLeon, that will be carried forward to next week.
Okay, so we'll go ahead and move through that one. Item 7.5, reconsideration of temporary closure of the Board of Supervisors chambers for in-person meetings. And Ms. Hutchinson, it's yours.
Well, this is just the standing item that you asked to carry each week so your board could reevaluate whether COVID circumstances had improved to the extent that you should consider reopening the chambers.
Okay. Any discussion, comments, questions from the board on this? Supervisor Scott.
My only question, I was looking to see if Christopher Veach was here, just to get an idea of how many people are actually coming to the libraries to check out a computer to be able to join our meetings. That would be an interesting data to know.
We can certainly ask him and get that information for you. And for staff that are doing the filming in the camera today, has there been anyone using the out-facing television that we have for folks? I know last week was the first time we had that up, and it was terribly cold last Tuesday, so it wasn't used. Sam, have you seen anybody using it today?
There has been no one outside today. We did have 2 people last week that watched for a short period of time.
Thank you.
Okay, any further comments or questions on this item?
And they're able to communicate, Sam, with the microphone if they had any questions when they're out there? That's set up, right?
Yes, that's correct.
Thank you.
Supervisor Simon?
Obviously, I appreciate this coming back each week. Obviously, important as we get our COVID-19 updates. I know that we've gone back to, we are still in the purple tier, and as we move through that process, I think it'll be laid out for us as we move to the operations when it would be somewhat safe to start having that conversation, open the boardroom again. So just appreciate in week to week, be expecting those numbers from both Dr. Pace and also Sarah as we move through the process over the next few weeks.
Okay, thank you. And so I've said my piece in the past iterations of this agenda item. I still stand on the same position. I know that we've received an email from at least another constituent in the county of Lake who stated that there was an issue with the e-comments, the limitation to 500 words. I've heard that multiple times, that 500 words is not 3 minutes. So I'm hoping that we can try and enhance that capability to make it possible to truly have a 3-minute public comment that can be submitted in writing. And also, I would like to ask for a change, which is that all public comment received in writing be read out loud to ensure that all board members have received them. Because I know in the past, we have received public comment during our meetings. And I think that those comments should be awarded the same standard as all other public comments, especially if it's received before the item is being discussed, or even during the discussion, as long as public comment has not been turned off for that item. I think that again, my position stands that we are not offering an equitable opportunity for all. We just had some power outages that would allow for people to come to the board chambers to be able to have access to our meetings during those times. And asking them to go to the library might not always be a practical way for some, depending on where they live and where they are. Yeah. So any further comment? Supervisor Pyska?
So I agree that having the e-comments read is perfectly acceptable moving forward. I believe that it was changed in the spring when there were lots and lots of e-comments coming in, but that doesn't seem to be the case any longer. I believe that this is equitable, that you can go outside of the board chambers and participate if you want to, and you have the library option. We did have power outages, but it seemed the two library locations and the board chambers still would have offered the same kind of participation options. Our numbers are getting better, but it's still important to note that we're still really far above where we were before November. So I don't think it's quite time to move forward with opening. I'd like to just see a few more weeks on how things are moving with our vaccinations, and if we have the new variant popping up all over the county, we're going to have to take that into consideration as well.
Thank you for your comment, Supervisor. Any further comments before I open it up for the public? Okay, Jake, let's go ahead and open up the Zoom room and see if anyone has a comment on this item regarding the opening or closure of our board chambers.
All right, I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Hi, this is Bart Levinson, and I'm wondering if a little bit more could be done, please, to make the public aware of what the library option is. I was unaware of it, and a caller called into KPFZ just yesterday to say that it existed and no one else knew of it. So if we could have more public information about that, please.
All right.
Mr. Chair, if I may.
Yes, please.
Yes, we did issue a press release probably about 10 days ago to announce that to the public. We can upload that to Facebook again if there are people that didn't catch it that time.
And maybe something like an article in Lake County News?
Yes, ma'am, I believe there was one.
Yeah, that's where the press release was sent, was to all our media outlets. And just to say it on here, if you go to our public library, we do have Chromebooks, devices that are available. There's also a public Wi-Fi in case you already have a device where you can connect to the internet in case you have no access to the internet. And that would be a way for you to be able to access this meeting.
So if I don't have access to the meeting, I should call my local library and find out what they provide?
I would, yes.
Great, thank you.
Well, it's the Lakeport Library and the Redbud Library are having volunteers to open early on Tuesdays so that you could go in and check out a Chromebook and then take it out to your car or wherever you're going to be right outside to participate.
So, Mr. Chair, we already have the answer from Christopher Veach, our county librarian, in response to Supervisor Scott's question, if I may.
Yes, he was listening.
He advises, well, we reached out, yes. He advises that there has been interest, so I presume that would mean they've gotten phone calls, but no one has actually shown up to use a Chromebook yet that they know of for that purpose. So it's certainly possible somebody had one checked out that used it that way, but they didn't specify.
Okay. Thank you very much for that update. And Supervisor Pyska, thank you for the clarification of Lakeport and Redbud libraries. Any other public comment? And I take it, Jake, that they still had the ability to unmute?
Yes, I did follow up with an additional request.
Okay. And let's go ahead and close public comment and bring it back to the board. And I'm going to make an assumption and just look at the heads nodding that we continue our protocol as is until further notice. And again, bring this back on the following meeting and rediscuss our current status with COVID-19 and see if we make any changes. Okay, so that is the direction the board is providing. Let's go ahead and move on to, I believe that we've touched everything except for our supervisors' weekly calendars. Is that correct? Okay, so let's go ahead and start. And Supervisor Simon.
Thank you. So obviously, board meeting today, finish this out, and then I have some meetings tomorrow, Wednesday the 3rd, have some meetings with constituents in my district. Let me double check here, make sure I'm not missing. So Wednesday the 3rd, I have a South meeting on Wednesday for the, I think it was moved to the 4th. Let's see, sorry about that. Draft South Main revenue model on Thursday. I have that meeting set up. I'm gonna see, I thought I had another one. Mental Health Services Act FY 2021 program planning meeting on the calendar also for the 4th in the morning. Calendar lost here. Friday the 5th, I have some meetings down here in my district early in the morning on Friday with a couple of constituents, trying to adjust that issue. Waiting for hopefully a meeting to be set up through Senator McGuire here with some local issues that are going on for some projects that are happening in Lake County. Monday back here, I got a meeting with Carol on Monday the 8th. And then back for the board meeting on Tuesday the 9th. I might have missed something. My calendars are acting a little crazy, but that's what I have right now. And if I did miss something, I'll bring it back up before the end.
Perfect. Thank you very much, Supervisor. Supervisor Pyska.
So before I do my calendar, I want to report out on a couple things. This was a wild week on the mountain. Last Tuesday during our board meeting, it started snowing, and power went out to over 500 customers just in the Cobb area, but I know there were significant outages throughout the county. This was the first time that I've had to deal with something like this in this capacity, and I'm really thankful for our CAO, Carol's leadership, and working with Sheriff Martin to kind of help me figure out how to help these constituents. It's been a difficult year for so many people, and being snowed in and not being able to leave and having trees fall all around you and having your power out, I felt like it was kind of the last straw for a lot of people. There was high levels of anxiety, and we really worked as a team to get some resources to these people through some avenues in the community. The Department of Public Works came out. I know they were plowing all over the county, and they were working day and night. So I really want to thank that team for working tirelessly to get those roads clear. That was a big deal, as well as Caltrans. The Cobb Mountain Lions Club, as soon as I asked them if they would open a warming center, they jumped immediately, and they had that warming center open by Friday when we realized that the outage was going to be extensive. And so I want to thank the Lions Club for jumping on that, providing a place for people to warm up and charge their devices. It was cleared with Dr. Pace. All the protocols were followed. It was a very safe place to be. Catholic Charities jumped in. They brought a bunch of blankets and socks and food. PG&E delivered 500 solar charging battery packs, 1,000 blankets, and a pallet of water bottles. That all arrived Friday night. So I'm really grateful for PG&E to really stepping up and doing that. And I know over the past few years, PG&E's gotten a hard rap for other reasons, but they worked so hard this week to get power restored day and night through terrible weather, and then bringing these resources here. I'm so grateful for that. I'm grateful for their support. I'm grateful for their dedication, and I hope that you all can see that too. NCO came through big time with a donation that had previously been sent from PG&E to support the warming center with refilling their propane tank. CAL FIRE, I don't know if any of you know this, but CAL FIRE had sold one of their really large generators to the Little Red Schoolhouse for $1 last year, so that this building could be used as a resource for people during PSPSs. So the Cabaret Council paid to have that generator installed last year. This was the first time it was used, and so I'm really grateful for that giant generator. It's amazing to have that. And then South Lake Fire, they went out and plowed the non-county maintained roads, which is a big deal when you have 1 foot to 1.5 foot of snow and you can't leave. So their crews were out there, again, day and night doing that work. So it was a huge effort. Is a warming center, they had 84 visitors over the course of 3 days. Now, so they were open Friday, Saturday, Sunday. Sunday, most of the power had been restored, but that's a significant amount of visitors coming in, and 42 of those chargers were given out. So it was a big deal. It was important, and I'm grateful for everybody that helped pull that whole thing together. One of the other things that happened was the cell towers went out. So there's no cell service in the area if you're through AT&T. So Sheriff Martin worked really hard on getting a temporary tower brought up to, it's right on Boggs Mountain. So until, the roads are impassable up on the mountain. The trees are down, the snow is heavy still. So for AT&T to get up there and do those repairs and fill their generators, it's gonna take some time. So having that resource here and having people connected again is a big deal. And so I'm really grateful for Sheriff Martin, who pressed hard for that. We have a lot of debris to deal with. Trees fell everywhere. In a lot of the areas, you couldn't see the snow because it was covered in pine needles and fir needles and branches. It was just green. So this is gonna take a long time to clean up, and I'm working with Chief Duncan and Chief Wink to kind of put some pathways together for the community on how they can clean up their lots and be ready for fire season. So it was a lot this week. One of the things that I really learned is that, we have a COAD that's been set up in our county. It's in its infancy. And one of the things that could have been easier is if we had a paid director of that COAD who could have activated the resources and kind of taken that away from, some of the other people that were busy with things. So I would really like to urge you all to think about ways that we can support the COAD as a resource going forward. I consider this a little micro disaster. It was a big storm. We haven't had a storm like this in 10 years. But I did attend a climate change webinar with meteorologists and scientists, weather scientists from Northern California. And the consensus is that California is going to experience prolonged dry periods and extreme wet periods. So we've already seen this with drier springs and drier falls, but that means we're going to get more precipitation in a shorter amount of time. So these storms might become more regular. So that's just something to keep in mind. Again, kind gestures from everywhere really helped this community get through. Morale was very, very low at times, and I'm just thankful for all of the support and everybody that lent a hand. It was inspiring, and more community members jumped out to help. So that was great. The Supervisor Simon didn't mention, but the Risk Reduction Authority, this is separate reporting. Risk Reduction Authority is planning a retreat for next Friday, not this Friday, but the 12th. And we're going to be doing some reorganizing of our priorities. And Supervisor Sabatier and I have been talking about doing kind of roundtable share out about how we're preparing for fire season. And I just wanted to air that I'm having both of those conversations with both of those supervisors, though we didn't have any cross coverage of topics. But I did want to let Supervisor Sabatier know that I'm going to refrain from those conversations until we can get the risk reduction kind of reprioritized over the next coming weeks. And then last night, Supervisor Simon and I attended the first meeting of the Lake County PBA, which is the Prescribed Burn Association. And that was led by Dr. Mike Jones with our UC Davis Extension. And we have a whole group of people in our county ready to collaborate on prescribed burning. And it was a great meeting. There was a lot of neighbors. There was people from the tribes. And so this is going to be a collaboration going forward and how we can long-term manage our vegetation over the years and kind of get into a maintenance program with all of that. So that was my week, and I will let you know how my calendar is. So this afternoon after the board meeting, I'm meeting with Supervisor Simon and CAO Hutchinson and Ms. Grant to talk about the risk reduction founding documents. And then tomorrow, I have a tourism improvement district meeting. I have a Zoom meeting with Congressman Thompson, an orientation with Carmen Koch, an orientation with Todd Metcalf, Calvert Radio check-in in the evening. On Thursday, a supervisor orientation with Kathy Saderlin, orientation with Rob Howe, reopening committee for Middletown Unified School District, and an orientation with Pam Samek. On Friday, I'm going to Elijah House. And next Monday, I have my weekly meeting with Carol and a AAA meeting in the afternoon.
Thank you very much, Supervisor Pyska. Thank you for your report as well. Supervisor Scott?
Yes, thank you, Supervisor Pyska, for all those shout outs to everybody behind the scenes making everything work. It definitely takes a village to get through, as you said, these little mini disasters that we have going on. My calendar today, I have a 4:00 department head eval meeting, and then I'll be attending the Lakeport Council meeting at 6. Tomorrow will be the last pit survey strategy meeting. Actually, it's not strategy because we had the pit count last week. We did an amazing job as a community going out, counting those who are experiencing homelessness. I think I mentioned this before, but only 20% of the counties in California actually performed the pit count this year, and we were one of them, and we rocked it, and the numbers are much higher than they were 2 years ago. So that'll definitely help bring more funding in to be able to help those individuals seek a better future. And then at 11:30 tomorrow, I have to go sign papers for First 5. I have a phone call with the executive director of Hope Rising at noon. At 1, I'll be meeting with the city of Lakeport and other representatives. We're working on filling out a grant to bring in programs to help our youth here in the Lakeport area. At 3:00, I have a meeting with constituents. On Thursday at 10:00, Mental Health Services Act meeting. At 3 p.m. on Thursday, is that? Hold on. I have, the COC meeting at 3 p.m. And I also have a meeting with administrative office at 3. So I probably will miss the COC meeting at 3. On Friday, I'll be taking my daughter to DMV to see if she can't get her driver's license. So we'll have another teen driver in the house, which will help with grocery shopping. At noon, I will be going with Supervisor Pyska to the Elijah House. And then at 4 o'clock, I have doubled up meetings again. I was supposed to be going on a tour of the Workrite building to see all the workers that we have in there. I've been told that the parking lot is full of employees, and I was excited to see that, but now I have an executive hope raising meeting that I have to go to. Saturday, it's not too late to buy your tickets for the Fair Foundation dinner. It'll be a drive-through dinner, so get online, purchase your tickets to support our fair, and then back here on Tuesday.
Thank you, Supervisor. Supervisor Crandall.
Thank you. Yes, so I'll report on a couple of meetings I went to last week. We first, initially, the solid waste, Lake County Solid Waste group, we met, and one of the big topics of discussion was the treated wood situation. And so we went into some discussion about that and how it's going to take some time, at least a couple months before some solutions start, coming to fruition. Because of some of the waivers, I think that will start accumulating at the mid-month here and start hopefully moving forward on the first of the month. But in the meantime, I've got a lot of constituents in my district that were asking what they should do with them. So I sent them some frequently asked questions, gave them some tips, and hopefully they're moving forward with figuring out what they're going to do with some of that treated wood, as it is that situation is very precarious because of the state mandate. The Potter Valley Ad Hoc Committee is the two basin solution. One of the situations I know that we don't stand pretty. We kind of have a lot of issues with that, as Lake Pillsbury, they're talking about the situation where they're moving to take down Scott Dam, and a lot of the discussion was based around accumulating funding in legislation that's coming down from the federal government. They're also not wanting to lose momentum on their plight as an NOI group. And so that was really one of the main topics of discussion. And so, I didn't really have much to say. More or less, I just wanted to attend to see kind of what was going on. Of course, I like the idea of, I've seen that some of the folks were talking about getting some dams taken down, and I like the idea of another dam being taken down, but not Scott Dam. And so I'll continue to advocate for keeping that dam, of course, because of not only because of the fire, the necessity to fight fires with Lake Pillsbury, but also because of the ecosystem and just the fact that we weren't really necessarily consulted with this situation. And one of the main things is that it was kind of put in Lake County prior to. So I won't go into another soapbox discussion about that, but I just wanted to highlight that I went to that meeting. And so today, be a part of agenda review with Supervisor Sabatier and Carol and Anita, department head of Al committee meeting with Tina as well. Wednesday, a TID meeting, and I'll be with Jessica in that one. And we'll have our first Earth meeting since last February. We'll be having on Zoom. And so that'll take place Wednesday, 4 p.m. And I provided the link to the chair, and that should already be out, actually, according to the Brown Act standards. So I'm pretty sure that's out already. And if anybody needs help getting onto that, you can email, text, or whatever the case may be for me. I'll give you that link. CSA 2, that one's actually a tangible meeting, and it doesn't get a lot of they have enough room to social distance, and it usually is comprised of about 10, 12 people at the most in a really big building. So they've done fine for this past year. And so I'll be attending that at 7 p.m. Thursday, I have something on my calendar called Mental Health Services Act 2021 Program Planning Meeting. So I'm pretty sure I'll be doing that. Friday, I'm going to follow up with some of the, we also had the Middle Creek Restoration meeting on Monday. And so there's a couple tasks I need to work on with some of the committee members, different committee members. And so I'm going to follow up on Friday to ensure that we keep moving forward on those tasks. As you heard us discuss the Blue Ribbon Committee earlier, that's a big project, but this is as well. And it's been going on for at least 20 years, almost 30, I'd like to say. But yeah, so I want to make sure we're doing our best to keep the wheels grinding on that. Supervisor Sabatier and myself are on that committee. Monday, back here with Carol for a meeting, for our weekly CIO meeting. And so I've reported on solid waste, ad hoc. Another thing I'd like to just commend, I know Tina mentioned the pit count. Never really been actively engaged in that, but my wife's been working on the North Shore with a couple folks. Lori, and I've had to actually go and not work on something, but I'd go to a spot and I've seen them doing this. And so it takes a lot of effort for you all to do that. And just seeing the folks that are dealing with the homelessness and that's noticing that a lot of people are just one emergency away from being in that spot. And so getting that number is very important. And I want to commend all of you for doing that work. We actually bought propane for somebody. We felt so bad. And so it's just, I'm glad to see we're working as a county on this. I'm glad it's on a priority list. And I just wanted to say, you know, especially give you a shout out, Tina, for that. Got a report on the Public Works Department. A constituent called me and wanted to commend, and I like to commend as well. So Jessica, since you did it, I'd like to go ahead and do the same thing. You know, Public Works, Mr. White was working for a constituent out in his area, and he said Mr. White was he followed through and did a great job, ensured that he got the feedback he needed to ensure his road was taken care of when he wasn't able to complete the project, but he let him know when he'd be back and whatnot. And that's so important for constituents at times. And so I don't get a lot of those calls. I get a lot of complaints more than anything, of course, but when you get a call giving props to somebody, I like to do that. So Scott, commend Mr. White for his work. And I'd also like to commend the Victim Witness Department. I went to consult with them about something, and just watching them work on different situations and the trauma that they have to deal with, very well. They work very well, and I like to see what they do. And so, yeah, just wanted to go ahead and do that as well. So that's all I have.
I just want to point out, EJ, your wife was actually one of the top survey takers that day.
Nice. All right, thank you for your report, Supervisor. I'm going to go back also just to add a little bit. Our waste task force, one of the other important items was we created a subcommittee to review our current ordinance, review other ordinances that exist on how to curb illegal dumping. So we're going to have both cities represented in that subcommittee, as well as myself for the county, and work with Director Ewing to see what comes back to the Waste Management Task Force, as well as eventually coming back this way to see what we can do to do a better job of curbing that problem. Also, later on that day, I did go to a National Monument Trail workshop. As we know, we have the Lake Berryessa Snow Mountain National Monument that was created, I believe, in 2015. And we were talking about what kind of access trails would need to be either created or enhanced. And I advocated for the area of the city of Clear Lake over the meeting. Didn't want to advocate for every little thing, since there was a lot of people trying to be there, but I'm thinking that the Walker Ridge area is a good place to also look at, and anything around the Indian Valley Reservoir that might be able to access that area as well. It was very limited for the fact that they were not there in their capacity to talk about trails in the National Forest. So it definitely kept it to other areas such as the Cache Creek Wilderness and areas like that. So those conversations are still happening, and I'm also, I'll use the word pestering our BLM partners, as we've been talking over the course of about 6 to 9 months about informational kiosks coming into the area that provide information to anyone visiting us or at our public parks or visitor centers on what exactly is the National Monument, how to reach the National Monument, and just some good information about it. And I think it's one of those things that we need to take advantage of in marketing our community here. Then we did have also, not to reiterate, but just to add to what Supervisor Crandall was talking about for the meeting with the Middle Creek Restoration Project, we are working on requesting an extension for the funding that was provided to us. More information to come. Our deadline is March 2022. And we still have a large amount of properties to acquire, and we do not believe that that could be accomplished by that date. For many reasons, it's a little bit behind. Part of that is the state, part of that is us as well. We've already re-signed recently with this board a new contract to work now with Monument in order to acquire those properties, and finishing up with Paragon, which was the original contract we had signed. So that's in hopes to move that forward and continue that process. This week, as Supervisor Crandall said, we'll be doing a review of next week's agenda. I'm planning to talk with our community development directors and other conversations today here after our meeting. Tomorrow, tomorrow, starting my day off with a conversation. I've been on the phone a lot with CPUC on multiple items. The last one has been about water, and talking with our low income oversight board about what can be done to help minimize the impact of rate increases to our communities. Also was invited and will take part in the environmental and social justice action plan that the CPUC is putting together. And simultaneously, I'll have to juggle those two. I'm also going to join the rural caucus of the CSAC subcommittee to make sure that our voice is heard on what our needs are. On Thursday, mostly pretty clear. If I can, I'll make sure to get to the Mental Health Services Act, but I want to make sure that our other supervisors who are actually on the board of Mental Health Advisory Board are there first before I take a spot. Later on, a CSAC call to get acquainted with any changes that are happening at the state level with COVID-19, and also joining the City of Clear Lake meeting that evening. Friday, starting off a conversation with our CAO as well as our PHO, and then just covering some of the work that I'm doing for some of the projects that I've been working on. And then coming back here on Monday, meeting with our CAO, a CSAC call, finishing the day with a PEG board meeting, and back here on Tuesday for another Board of Supervisors meeting. So that is my itinerary for the next week. Any other comments before we go ahead and close up and do our closed session? Okay, looks like everybody got what they needed. So that completes our agenda for the day. We will be going to closed session where we have 4 items to discuss. 8.1 is conference with legal counsel, significant exposure to litigation pursuant to Government Code Section 54956.9D2E3, claim of Earth Waste Foundation. 8.2 is conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9D1, Sabaloni versus County of Lake. 8.3, conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9D1, Fleisch versus County of Lake. 8.4, conference with legal counsel, existing litigation pursuant to Government Code Section 54956.9D1, Nichols versus County of Lake. And with that, we will go to closed session for the remainder of our agenda. Thank you, everyone.
And Mr. Chair, we're going to stay right here in this room, so we'll give it a few minutes to clear.